Okay, welcome everybody. We're going to get started. I'm Karen Solheim. I'm Director of Undergraduate Programs and just going to do a couple of introductions as we get started. And we know that there's people here who are attending by live stream. So welcome to those people from afar. And with that in mind, please notice that you have mics on your table in front of you. So we'll ask sometimes. Definitely, we want to hear from you, so just be ready to push that down so you see a green light and you have to hold it, and then your comments will be heard by the people in our audience from a distance. And first of all, a couple of introductions. I'd like to introduce Nicky Lemon, and Nicky is our new Director of Clinical Practica. And so, Nicky, would you like to say hello? You're welcome to push down your mic there and maybe tell a little bit about your role or
Thank you. Well, if you couldn't tell, I'm new to School of Nursing. I have not yet pushed the button on this microphone. So my name is Nicky Lemon. I am the new Clinical Placement Program Director.
If this is easier, you can use this. You're good.
I'm good. If you can hear me, can everyone hear me? Okay. So my office focuses on the sort of nuts and bolts and operations of clinical placements. And so you'll be hearing from either me or my staff, most likely if you are sort of the main site contact. We don't always have as much direct contact with preceptors, although I certainly welcome any questions, comments about any of sort of operational things around clinical placements, or if you're just not sure whom to contact, certainly start with me and we'll make sure that you get to the right place. But I'm excited to be here and to meet all of you. And so Nicky Lemon, and I think our contact information is going to be uploaded into the box, so then you'll know who I am and how to contact me as well.
Thanks, Nicky. And Ann Johnson. Probably people have a lot of contact with Ann, I would guess, in terms of some of the logistics. Thank you, Ann. And Ann did a lot of work behind the scenes for today, so thank you. And then Dr. Jessica Coburn, who you'll be hearing from and who Dr. Willis introduced.
So people
Yes.
see me on the live stream.
Oh, yeah,
Hello.
good. Okay. Is there anything you'd like to say to get started?
Not really. You'll be hearing from me plenty today. But just know that I'm always available to take your call or your email and answer your questions.
Great. And then we also have faculty in the audience. So Sean and Tracy, I'd just like you to go ahead and introduce yourself. And Sean and Tracy, and tell a little bit about what you'll be doing with students in this course.
Hi, everybody. Tracy Seiler-Schultz. I'll also be working with Dr. Coburn in the traditional 436 and 446.
My name is Shawn Skirke, and I will be working with Jessica Coburn as well. In 436, I'll be doing a community immersion up in Door County.
Okay. And this fall, faculty working in the course with Jessica will be overseeing some of the students in your sites. Is that correct?
Yes.
Okay, very good. Okay, so we'll get started. And our first speaker today is Dr. Barbara Bowers, who's going to talk about the Center for Aging Research and Education.
Thanks, Karen. Okay, I'll do this because I never stand still. Is this on? What do I do? Oh, there it is. Okay. So this was, first of all, I want to thank everybody for all the work that you do. I know precepting is demanding physically, emotionally, intellectually, and we really do appreciate everything you do. I'm here to actually tell you about the Center for Aging Research and Education, but really to make a pitch for including information, experiences on care of older adults, even if you're in a pediatric setting, kids have grandparents. And so I just want to walk through, let's see if this is the right one. Okay. Several years ago, we started a Center for Aging Research and Education, which had really the mission, I'll do that in a minute. Our mission was really to support research, educational experiences, and outreach to the community. We've done a lot of outreach. I'm going to pass around our annual report, which we've made it to almost every county in Wisconsin with outreach programs, educational programs for community providers, and we're still doing that. We have probably driven Karen Solheim crazy looking at the, and she's not denying that, I see, really combing over the undergraduate curriculum, the new curriculum, concept-based curriculum, looking at what's in here that relates to older adults. What experiences are people getting? Is this aligned well with the national recommendations for competencies when nursing students graduate? And so we've got a pretty good cadre of faculty here, probably 7 or 8 people who are really committed to making sure that this happens. Whoops. Boy, this is touchy. Okay. I just want to show you a map that demonstrates where we're going as a state in terms of the older population. I don't know how many of you see this or work with older populations, but the one on the left is 2015. The one on the right is 2035, which isn't all that far away. And as you go from green to blue, that is from 12 to 15% of the population being older adult, all the way up to 25 to 30%. It's a huge increase. And we just finished doing the RN and LPN workforce trends for the state, and in terms of people working with older adults and working with rural areas, which a lot of those places are, we're actually seeing a downturn in both groups. So I don't know who's going to be taking care of this increasing population, but we really need to start convincing nurses to work in this with this group. So hopefully you're all on board to help us with that. In 2008, the National Academies of Science came out with a report. They'd done extensive years of work looking at how prepared is the workforce for the map that I just showed you, or even for now. And what they found was that the majority of nurses, physicians, dentists, social workers, you name it, people involved in the health professions, are unprepared to take care of older adults. They get very little training in their programs, and they aren't actually doing a very good job. Taking care of someone who's 90 years old, who's just had a gallbladder surgery, is pretty different than taking care of someone 40. Different in the hospital, different in terms of transitions home, different in terms of follow-up. Caregivers, that 90-year-old often has a 90-year-old caregiver, which doesn't often work very well. So what they found was across the board, we need much better, greatly enhanced training in the basic skills of taking care of older adults. At the same time, if you look at the workforce trends and the trends in aging population, one of the most important answers is let's make sure that people are more independent and more functional, more able to take care of themselves as they age. And that has happened a little bit. We have a little bit of a downturn in disability level of each age group as people get older, but nowhere near enough to make up for what's going on. We also know that there's a lot of missed opportunities, whether it's hospital, home care, community care, any kind of institutional setting, long-term care. Functional issues are not well taken care of. A good example is someone who is in the hospital, comes home or goes to a nursing home and is not ambulatory. That often is the set point. People use that as the baseline and say, oh, well, this person doesn't walk. Well, the person walked 3 weeks before, but that's not often picked up, and so they're just left not ambulatory. And as you all know, within a couple of weeks, they're probably permanently not ambulatory. Nutrition, so the list goes on, which I don't have time. They're not giving me the whole day here. So, but there are a lot of missed opportunities where we can actually make those people more functional and both reduce the cost, reduce the need for workforce, and improve people's quality of life. There's also, I know, 47 million caregivers in the country, most of whom are doing care without a lot of help, many of whom are still working and are feeling the pressures of raising younger people, taking care of older people, working full-time, part-time. So some attention being paid to this now, but actually not very much. So think about people who in your settings who are caregivers. And it would be wonderful if students had experiences to look at what's going on in caregiving. How do you keep the caregiver healthy as well as the person they're taking care of? What support do they have? There's a lot of community supports that are not used very well. And then one that's actually the most controversial is the National Academies Institute of Medicine have recommended that each category of worker work to their full capacity and legality, which means we need to let CNAs do more, which means we need to train them. We need to have family caregivers do more. Nurses should be all familiar with scope of practice and all of the things that try to push us back. We do that to other people as well. So that's something else that's probably going to have to change. I just want to tell you very briefly about a study that we did, which I think is pretty relevant. So several years ago, we had I do this almost every year, go to the new class and ask, how many people are interested in care of older adults? And I usually get 2 or 3 hands going up. I think there's more than that, and people are embarrassed to raise their hand. It's not a really popular thing. I know that people, I've had students tell me that when they say they want to work with older adults, the response I get from family members, healthcare providers even is, ooh, really? Why do you want to do that? Why not doing ER or ICU or helicopter nursing? Those are more glamorous. So that's a real problem. And what we saw, we did a survey, we saw that the view of working with older adults was it's custodial, you can't use your skills. If you have any, you lose your skills. It's not very demanding intellectually. So we set up clinicals, wonderful clinicals, where people are, the preceptors were great in terms of these are the challenges, these are the skills you need. So by the end of a year and a half, the students, there was a huge shift in the view of complexity of care, and we still had nobody who's saying they wanted to go into a setting where it was mostly older adults. So we went, wow. So what happened there? So we did a focus group, and what they said was, it went from thinking, well, there's nothing here, you don't need any skills, to this is way too hard. I'm not prepared for this. So we're hoping that people will feel prepared by the end of a preceptorship. But they need to learn a lot of skills in order to do that. And I'm almost done. Whoops, I'll go on. So we have a Center for Aging Research and Education, which was a response to we need more research, we need more support for our preceptors in terms of education. So we've been doing a lot of work finding new clinical preceptorships, looking at how even pediatrics can participate in this, and we've developed a number of products, supports. I think Jessica is giving you access to most of those. So we have faculty who are happy to meet with you, consult with you, meet with students in clinical settings. We can provide, for those of you who don't have access to our libraries, please let us know if there's anything you need, and we will make sure that you get it. And then we have, just briefly tell you about this, we have a program called GeriRes, and we've spent 5 years creating a long-term care nurse residency program online, which is several hundred organizations have already used this. So it's modeled after the residencies you see in hospital, only it's all online with a clinical coach in their setting, or if there is no person in the setting like an assisted living, we actually have a clinical coach on site who works with those people. The residency program is 16 modules, and it's got lots of assignments in it. I think it'd be a wonderful thing to do along with a long-term care preceptorship or any place where people see a lot of older adults. It's sort of the big issues. The first module is what is long-term care and how does it operate? So in long-term care settings, that's great. But the rest of it works for almost any setting. We have Dementia Simulation Program, which we've been distributing around the state to a lot of organizations. We have manuals that we've developed for caregivers, which you're welcome to download. We'll make sure that you get them free copies. We have a program in 3 rural counties to support caregivers, develop an infrastructure for the community. We have an online app to support caregiver decision-making, dementia-friendly toolkit, and a newsletter, which we're happy to sign up for. It comes out every month, and it's just updates on things that are going on with older adults, sometimes new research, clinical practice ideas. So I can't talk any faster than that. I think I have at least used up my time. So any questions? There's some nice resources that Jessica's given you access to as well. So thank you very much.
Thank you so much, Barb.
Thank you, Barb. I was so glad we could lead in with that because it kind of speaks to the direction we're moving in supporting preceptors. So the resources that Barb talked about, we will be able to see once we look at the new website that we launched today for preceptors, which will house this type of information and links to things like the care resources and Agefully and resources for preceptors in other settings. One of the things that we want to improve upon in terms of supporting our preceptors is linking you with the type of expertise that we have here at the School of Nursing. So we have a lot of resources. It's just been a challenge to get them into the hands of the preceptors who are working with our students. So hopefully having a web page on the School of Nursing website that is accessible to anyone without a password and includes some of these resources will be helpful in the work that you do with students. So it's just one of the new improvements that we have been working to make to link you with some of our expert researchers here at the School of Nursing. So I'll be showing you that in the next section. But as I said, I think it gives you a nice overview. Some of the other things we're going to look at in the next couple hours are what the students do in class, what kind of writing assignments that they do that you'll be able to look at and have a hand in working with them on if you choose, how to evaluate students, and how to look at student hours. So we'll be going over all these things, and as well as something that's been asked for in previous workshops, what skills and abilities do the students come in with? Because that's always been a question that preceptors have come in with. So just a little preview of the other things that we'll be going over this morning. So next on our list is looking at the website, the Preceptor website, as well as Typhon, which is our system for tracking student hours and also for evaluating students at the end of the rotation. So Jonathan Henkel is going to join me up here, because he's in charge of Typhon here at the School of Nursing.
I didn't build it.
Because no one else wants to be in charge of Typhon. No, but you know what? We're here to help with Typhon, and so this will give you an introduction, or if you've worked with it before, maybe a little refresher. But going forward, please know that me and Jonathan are here to help with Typhon. And I guess what I want to say about Typhon before we jump in is it is illegal for us to put directions for Typhon on the internet. So what you will not find on the Preceptor website is anything like directions for Typhon, because if Typhon sees us do this, then they demand that we take them down. So these are things that I send in emails. I send PDFs with screenshots with instructions for Typhon, and that is the way I have to distribute that information based on the copyright laws pertaining to Typhon. So now you know the method to my madness when it comes to emailing that information. So we can also, I believe, post those PDFs in Typhon because it's password protected. We just can't put anything that's accessible without a password. So that is the story of that. Maybe I'll set my computer down, hey? Do you mind if I start quick?
Yeah.
Okay, since you brought up the website. So this is our new Preceptor website. As I said, it just went live today, so it's still a work in progress, and I'm hoping that since you're here, you can give me other ideas of things that you might like to see here. But so if you look at it, it has, first of all, a list of our clinical partners, which if you click on, you will see is extensive. We work with upwards of 130 to 140 different sites and units. So, I wanted preceptors to have an idea of all the different types of settings that our students could potentially be placed in, because there's quite a variety. We haven't pared this down, so it does list each and every single unit, but so that's on there. And then there is a link to our programs, which, because today we're discussing mainly the undergraduate traditional program, but come January, these senior level students will also include accelerated students. So if you are wondering about any of the programs, and obviously this also links to some of our graduate programs, you can get that information here. Okay. And I think this is the tab you'll be most interested in. So this is specific preceptor information and resources. It does link to Typhon. We can put that on here. And as requested, our Typhon account number, which is one of the most common questions we get. So we made sure to put it in big numbers right there on the front page. Tracy, I took your advice on that one. But this also includes things like our program plan. There is an extremely extensive preceptor handbook, which is a couple years old now, but it's 100 pages. And it does include resources about teaching and precepting. And I don't know that this was available last year for whatever reason, but it's back. And we put it up here with the hope of revising it during the year. So feel free to look at it. Just know that a couple of things may have changed, but the core advice for preceptors has not changed. So that is available on the Preceptor website. There is course information for our Year 2 courses, and setting specific curriculum information. This is something that we'll get into a little bit later in this workshop, but it has, it links our curriculum objectives to different settings. And so, we hope to keep adding to this based on feedback that we get. You can see, as you'll have a little bit of an overview of our curriculum, you'll see our concepts on the left there, and then clinical situations on the right that are linked to those concepts. Okay, and then these are what we have so far for population-specific resources. So Barb just went over the Center for Aging and Research and Education, and they have so far sent us a couple of resources. Clinical experiences. There's a really, really nice article on clinical teaching in nursing homes. So this is the type of information and resource that we want to expand on this website. So far we've gotten the care materials, and our goal moving forward is to work on other areas of expertise in the School of Nursing and putting those resources here so that preceptors can access those things and or follow up with those groups for more information. So as I said, if you have ideas or resources that you'd like to see on here, that is where they will be moving forward. And then the contact us page. So as I keep saying, feel free to contact us anytime. It's better to hear from you sooner rather than later if there is an issue, but also, if you need a site visit, a phone call, an email. These are things that you're definitely entitled to request from us, and we're happy to provide if needed, and even, sometimes if not needed. We do try to get out and visit our sites as frequently as possible. But always feel free to let us know if you could use a visit, an email, or a phone call. So I'll turn it over to Jonathan for a moment to talk about Typhon, and then we'll continue on. But this, I don't know, did we publish this web address anywhere?
That's a good question. You can take it down. So the web URL to get to this site is preceptors.nursing.wisc.edu. And I'm not sure if that's in your packets.
I don't know. And is it linked on the School of Nursing site yet?
No, but we will do that.
Okay.
I'll go back to my office after this.
Ask and ye shall receive. Okay.
Yeah. And then I'll also point out on the top right-hand side, there's a little utility menu. This will link you to a few of the other web properties that the School of Nursing has. So this is the School of Nursing's main site. And then we have a website exclusively for students, and that's geared towards that audience. And then on the very, very right, top right, is a nice little directory there. And this could be useful for getting somebody's specific, unique contact phone number and email address if you didn't want to email a service account. And so, yeah, so those are all available to you. And we'll try and link back and forth from each of those pages to this Preceptor site too. But if you didn't get a chance to write it down, it's preceptors.nursing.wisc.edu. And I'm going to talk to you for a little while about Typhon. So Typhon is the tool, the online tool. It's a vendor solution, so it's not we didn't build it here in-house. We subscribe to it. The students actually pay a fee for the service. And primarily, the service will get used between you and the student for their evaluation, but also to give you some oversight into how they're logging their time according to what we are seeing and what our official record is. And so we'll have a look at the system today to show you how to do those things. Just to get a sense of who I'm talking to here in the room, I know there are some people at home, but are any of you new to Typhon? Have never used it before? Okay. We've got one or two hands. And so I will start at the very beginning just for the sake of making sure people know how to get into the system. But this might be a little bit repetitive for those of you who already have access and have been inside of Typhon. So your very first exposure to Typhon after today will likely be this email. If you haven't already received it, you'll need to reach out to somebody in the clinical staff to essentially create your account. And then when your account is created in the system, we have an ability to send you out this email with your login information. And if you're and the reason I spend time on this is because if you're anything like me, you get this email and you immediately think it's spam and you delete it. Or you look at it and you're like, there's a lot of words here. Your eyes may be drawn to the link in the middle and that link looks suspicious, which just sort of feeds your concept that this is maybe spam, and then you delete it. But no, this is not spam. It'll come from an administrator, so this one came from me. Sometimes that'll happen, Jonathan Hinkle. Sometimes it might come from Ann Johnson, potentially from Nicky Lemon, one of us here in the office. And it'll always say via Typhon Group, and that's the organization that vendors this solution. So those are good things to know. The link is fine to follow. You're good to click on that link. And in fact, the very first time you do click on that link, you might come to this page, enter in your email address and what you think is your password, although you might not realize you didn't set your password up yet, and then you'll just get like really confused and frustrated. But if you go back to the email, you'll see somewhere in this text there is a temporary password that you need to extract and use the very first time you log in. And for some reason, that's tucked away here very obscurely in the sort of bottom right-hand corner there. And that temporary password you can just copy out of the email and then paste it into the password. The next screen will ask you to change your password, and then from that point on, the password that you change it to will be the one that you use to log into the system. And strangely, that isn't the most important thing in this message. I'm an inbox 0 guy, so I'm just going to delete that. So the most important content in this email, strangely, is not your password and it's not this link, but it's this message down here that says, hey, you only have 7 days to do this. And so if you get this message, and you're very busy people, and we really do appreciate everything you do with our students, and it's very reasonable to think 7 days will pass and you haven't gotten around to creating your account yet, just know that when you come in here to do it, that temporary password would no longer work. So you'll need to request a new one of these emails to get sent by one of us, and we'll gladly do that for you. And I think that is all there is to say about that. Yes?
So we already have an account with Typhon.
Yes.
For past students.
Yeah.
We don't have to.
you don't have to do any of that. And so, yeah, that's why I hesitated to kind of go through that, but just for the sake of anybody who hasn't done that, if you've already been in the system, and thanks for asking so that I can let you know you're not going to change your password, you're going to have the same password. Now, if you forget your password, there is a I forgot my password button on the login screen. And so, again, from the Preceptor site, which we've made for you kind of as a good hub kind of for all things precepting here at UW, that link there will take you to the login screen, and then from there you can click on the I forgot my password, and it will resend you one of those temporary password messages in your email. And so, yeah.
And I would recommend maybe early in the rotation checking to make sure you can still log in, because sometimes preceptors know that they have an account and then it comes time to do the evaluation and they find that they can't log in. So it's nice if you're able to get logged in early in the rotation just so that you know you can do it.
And here I have logged myself out. So I'm logging in, and I want to log in as a preceptor so that you can see what a preceptor does. Okay, so none of those things you just saw on the screen would be things that you would see. But once you log in, this will be your main menu screen. And after you've established your account, this will be the screen that you see every time that you successfully log in. And you can see right up here at the top is probably one of the most important things in the system, which is how you will be evaluating your students. But it's also where and how you'll be seeing your students' evaluations of themselves. So the workflow is that the students are asked to complete a self-evaluation just prior to you doing your evaluation of the student, which gives you the ability to kind of see how the student is self-assessing prior to you kind of submitting your evaluation of them. And so I'm going to jump right into that just to kind of show you a few things, because it's not necessarily intuitive, but it is newly redone, so it looks a little newer than some of the other areas in Typhon. And this is the evaluation system. One of the very first confusing things is that the system is set up to be used across all of our courses and all of our programs. And so you're going to have access to and see evaluations in here that you won't be completing for your student. You'll be focusing today, I think we're just talking to 436 preceptors. So you'll be completing, make sure that you're clicking on the evaluation relevant to 436, because the evaluation for this course 519 is for the BSN at Home program, and it's very different. The evaluations are very different. And so this is the evaluation that you'll be completing for your student. Now, again, prior to completing your evaluation, you're going to want to see the student's evaluation of themselves, and that is strangely tucked away into your history, your evaluation history. So the way that we have to set this up in order for you to view the student self-evaluation, it's set up in the system as though the student is evaluating you, but really they're not evaluating you, they're answering questions about themselves. This is a way for us to give you access to the student self-evaluation within Typhon. So I wanted to clarify that because it can be confusing. So for that reason, to view the student self-evaluation, you're going to click on the View History button from this screen. And so when you click on View History, you have two tabs. You will be able to see your history of evaluations that you've ever completed for students. And if you are not new to the system, if you've been in here before, this has all been kind of redone. So the screens might look different to you if you've done this before. And then this tab, Taken About Me, again, this is where the student self-evaluations will be housed. And so in this Taken About Me tab, this is a couple examples of a student who's completed self-evaluation, and this is our fall course, 436, and then the evaluation for 446 is a different. We kind of toggle them on and off, right? So you don't see them both in that prior screen all at once. But you will be able to see the history here. So in the spring term, if you're still working with the student, you'll be able to see your evaluations or the self-evaluations and your evaluations, not only from the fall but also from the spring. So clicking on View on one of those self-evaluations will bring up their response, and you can go through. The first group of questions are kind of just establishing who the instructor and the site, number of hours absent, and this is actually an old evaluation. We might have changed a few things, but and you'll be able to go through and see for each of the items what they're rating themselves, how many points that's worth, and then there's a total, I think, all the way on the bottom. So there are a few. There are quite a few items, and you'll see at the very bottom there are some open-ended strengths and areas for growth, and all of those things can be reviewed by you. You also have an ability, if you're not the kind of person who likes to read all these lengthy things on the screen, you can print them out or export them to a file. You'll have the ability to do all those things. And so that's how you view the self-evaluation. To complete your evaluation, now you have to go back to that other screen. And so you can actually use the back button, or there's a blue button here that will bring you back to the screen that we started on. And so from here, clicking on the evaluation, you'll see a little pop-up over here to the right with a few tabs. There's a new feature in the system that allows a student to initiate an evaluation, meaning that like it's evaluation period time and a student needs you to evaluate them. They can actually go into Typhon themselves and say, I need my preceptor to evaluate you. And it's who's your preceptor, what evaluation, and then what will happen is you'll get a notification that looks like this, that just says essentially your student has prompted you to evaluate them within the system. And that's just kind of a nice way for you to actually start the evaluation without you doing anything. And so you'll notice this tab on the left that says scheduled. These are going to be evaluations for students who have initiated an evaluation from you. And so to start that evaluation, you would just need to click on that green button here to begin the evaluation. If the student did that, or did not do that, rather, you won't see that tab there. You'll just see this new survey tab. And the first question will be, who are you evaluating? This list of students is all of the students in all of our programs in nursing, and it's need to know. So you would come in here, you would specify who your student is, and then again you have that green button there to begin the evaluation. And then this is the evaluation. So there are some instructions here at the top. You have, this is the scale that you'll be rating on, so you'll go through and provide a response to each of those items. And this is where having the self-evaluation can kind of help guide you to get that an idea of how the student is self-assessing. Under each item, you do have an opportunity to open-ended response on any of the prior items within that section. And so you do have some options to do that there. I believe all of the items are required. I don't mean to be making you dizzy. I'm just trying to get to the bottom. And so at the very bottom, this is kind of an important thing because we do have a lot of preceptors who come in here, perhaps during the course of their workday, will start the evaluation, something will pull them away from their computer, and then an hour or two later they come back only to realize that, just like many websites like this, you get timed out. And so it will kick you out after, I think, an hour or half an hour even. So to avoid doing that, anytime you're walking away from your computer when you're mid-evaluation, you want to scroll to the bottom like I just did, and there's a blue button here that says to save the progress and exit. And then that will allow you to pick up where you left off last time. And then once you're all done, there's the submit survey button. It's not going to allow you to submit if you have required responses that weren't completed. And so it'll highlight those and you'll have to go back and answer those. So So after you save it, yeah, you don't actually have to save it at all. Like, so if you get in there one and done, like you're doing it all, you don't have to hit the blue button. You just have to hit the green button. It's a good habit to save it, and so yeah, I don't blame you there. But yeah, if you're in there and active, it's only when you're inactive. So it's only when, yeah. So if you're in there and typing, you're fine. You don't have to complete it within that half an hour. It's just that if the system knows that you haven't typed anything in there within that period of time, that's how it times you out. And so hitting the blue button is good practice. You'll see that you do have the option to resume once you did save. But you do have to submit it. It sits in the system as in progress until you hit that green submit button, and the course coordinators and other people who are running the course on our side won't really see it as a submitted response unless you hit that green button. So both of these buttons are your friend. Ultimately, you will definitely have to hit the submit survey button, and then the save progress button is a good button to hit, but only one that you would need to hit if you can't complete it within a single sitting. That's all. All right, good questions. Any other questions about the evaluation system? That's pretty much it. You got the self-evaluation over here. You got your evaluation of the student here. The history, once you do submit those, will be back here in the View History button, and so you'll see previous responses. You won't be able to make changes once you hit the green submit button. We can administratively, if you want us to, put that back into an in-progress status, which would allow you to make changes. So if you did submit something that you wanted to change afterwards, you can reach out to myself or somebody on the clinicals team. A good way to do that is just to email that clinical service account. And we can put this into an in-progress status, which would allow you to go back and edit it. But there will be a deadline, and this, I'm sure the student will be communicating that with you. And it'll all have to be, I think this gets done mid and final? No.
So I will put the due date for this in the preceptor letter that I send out after class tomorrow. Once I meet with all of the students and get all of the preceptors' email addresses, I have a sort of general information letter that lists general information in terms of number of course hours and expectations and contact information, but it also has the due dates for the evaluation, which for the first rotation is, let's see, it ends on the 27th, so I think the 20th it's should be due. So our process is the student does their evaluation 6 weeks in. That gives you a week to look at their responses and then fill out your own evaluation. And then it gives my instructors a week to go through the 160 evaluations and make sure that they're all in. The biggest issues that come up are usually either timing out or can't get into Typhon, and it's just as an example, it's typically, people will come in, they're working, they have 3 12-hour shifts a week or whatever. They're trying to get this evaluation done. They can't get into Typhon. It's Sunday night, and they can't get a hold of us till Monday morning. And then maybe they don't come back to work until Friday. So this is the typical scenario that kind of trips up students and preceptors, which is why I always encourage people to log into Typhon early on so that you can get in there. We can definitely work with you if you're, going on vacation, going to be gone, need an extension on the deadline. We just need to get our grades in for the students. They're issued a grade after 8 weeks, and then it's a whole separate course the second 8 weeks. So we are working with our own deadline for the School of Nursing for grading, which is why we need those evaluations in a timely manner if possible. That and just the sheer number of evaluations that we're trying to track down at that moment. The other thing to note is, so the students can see these once you submit them, and then we see them. So those are the two other parties that will be reading these evaluations and looking them over, just for your information. And they do kind of become part of the student's record. So if we need to go back the next year or in the future and look back at them, then those are sort of permanently stored here. So we really appreciate you taking the time to do those evaluations. It's amazingly helpful for helping us understand where our students are at.
And for the student, right? And so originally the process was like, it was designed as a collaborative process. And back when it was on paper, it was essentially just shuffling the same piece of paper back and forth between all of the important parties. It's pretty much the same thing. It's just now in this more complicated system and electronic. But the idea is that like this is information that's shared with the student so that the student, has an opportunity for growth, et cetera. I would say the one other common mistake, aside from the ones that Dr. Coburn just pointed out, is completing the wrong evaluation. So getting timed out, not getting logged into Typhon, and then completing the wrong evaluation are the three sort of most common things. So if you can avoid those three, which is totally doable, you'll be in good shape.
And I do mention that in my notes that I send out, like please avoid the 519 BSN at home, because unfortunately we have preceptors that fill that out, and then, like I said, it's a totally different evaluation. It's very short, which is probably part of the appeal.
It's all open-ended, too. Yeah,
it's all open-ended. It's like a third of the length of ours. The other thing I wanted to say is I do attach a PDF copy of the evaluation to my email that I send out this week on Friday, so that you can look at it before you go in, and just have a copy of that. Like I said, we can't post that on our Preceptor website, but I do attach a copy of it to my email, just so you know like what you're going to be evaluating at the end of the rotation. So
cool. So the next section in the menu here is an area called case logs, and we don't have there's no formal requirement for the students in the undergraduate level to get involved in case logs. And so if they're doing anything in case logs, you would be able to see it, but it's not something that they're being asked to do or required to do through their program. And so we're going to skip over that section because you really don't need to know it, but I'm pointing that out so that you know what those things are. Case logging is, like you would expect, a very detailed kind of log of the student's encounter with a patient. The time logs, however, is something that we are requiring the students to do. We don't have a requirement or an expectation even that you as a preceptor will be doing anything to approve those time logs. The assumption is that if we're not hearing from you and the student is logging their time, everything's on the up and up. But you do have access to look at it, and I would encourage you to go in and look at it just to have oversight, I guess, as to what the student is reporting back to us as far as their hours. But again, there's really no expectation that you're reporting back to us on this unless there's a problem. Go ahead. Yeah.
And actually, I would encourage you not to approve hours that the students put in, rather just look at them, but it'll prompt you to approve them. But if you do that, then they can't be adjusted or resubmitted.
I think I turned that off, actually. I found a setting where I can turn that off. So you no longer have the ability to approve hours within the system.
Yeah, because we had an issue last year with students putting them in the wrong column. As you can see, these columns on here, and then if they were approved, they couldn't move them into the appropriate column. So we did remove that function. I'm really happy about it.
I did. I took the liberty without saying anything to anybody. And so I'm announcing it here. New feature. You don't have to approve time. You cannot. There was a column over here to the left, if you've used the system before, where you had little icons where you can approve the time. And what that did was it locked the time from editing for the student. And if the student had improperly recorded their time, meaning like they recorded it as shift time instead of directly supervised, that would just really confuse the course coordinators. And so we did away with that, and you can no longer do anything in here, but just, again, it's all about oversight. The students are expected to log their time with you, and that time should get logged as experiential, directly supervised. We work with the students to make that happen. There's really nothing we need from you in regards to support to do that. But obviously, if a student isn't meeting their time requirements and making shifts on time, obviously that's very important to us. And communication to us through email or calling would probably be the best way of dealing with that if you're having issues there. Yeah, so when you come into the screen, you'll have a drop-down where you'll see any student who's ever logged time with you, and once you pick that student from the pick list, you just click on Apply Filters. It is possible, like in the spring, if you're working with a new student and they had hours in the fall, you would be able to see those hours from the fall from that different site, and you can kind of see that here. If you wanted to limit it by a date range, meaning you only want to see hours that happened after January 1st, of the new year, you would just enter in that date or pick it from the date picker, and then hit Apply Filters, and then that would filter down the list further. And so this is the time log screen. You can export the time logs. I'm not sure why you'd want to do that, but you can. Any questions about time logs from the group? We haven't really asked questions about anything yet, so or given you opportunity to ask questions, but this is sort of one of the last things. Yep. Do you want to hit the button just in case? Yeah. Thanks.
There we go. Hi. It's really a small thing, but just the language shift
Yeah.
is really something we don't use in community health nursing or school nursing. So it's just a cultural sort of thing, and I wondered if that was just part of the program or something. It's just an observation. It's really
What do you mean by language shift?
the language that says shift hours.
Oh, in the time logs?
Yeah,
That's confusing for us too, and we don't like it, but that's one of the delivered.
use that column.
We actually don't use that column.
Okay.
No.
Total shift time is a column that like Typhon just puts in there, and we
Got
don't
it.
have the option, or at least I haven't found the little box.
Can't get rid of it.
Can't get rid
That's
of it.
the
Okay.
problem.
Yeah.
That's
because
interesting.
It's confusing to students.
It is.
We don't use it. We have to specifically tell them, do not put anything in that column, because the ones that we use are, directly supervised
Yep.
hours. They need to log their seminars. They have some flex hours in our course, which I'll talk about later.
Yep.
And they have simulation.
So I saw some time under shift in there.
Yeah, this is an example
yeah.
student that I'm pulling up on the screen, and so these are just logs that I put in here to show people how to do logs.
Great.
Right.
Yeah.
Great.
And that was probably me telling them not to do
frustrating for
that.
us because Typhon will not let us get
That's helpful.
rid of the
No, that's a
column
good observation and a
or
good point.
change
Yeah.
the title of it. So, yeah.
Yeah, great. Okay, so under student information, you'll see a list of students, but only students that have ever time logged or case logged with you, meaning that when they entered a time log, they specified you as the preceptor. Then you would see the student from the student list. And in the student list, probably the most important thing is that there's this passport where you can see essentially a little profile about the student. Occasionally students will upload a profile picture. We don't ask them to, but sometimes they do. And then there's just some information here. We haven't revisited this in a long time, and maybe at some point we'll come in here and revisit this to make this more interesting to you. But the idea was that the student would provide information about themselves as it relates to their work with you, and then you could come in here and see it. But obviously I think through the course of working with the students, you'll get to know them even better than you would if you pulled up their little profile. And so that's what the student information page is. The event schedule, the clinical placement office uses this space to place the students. And so there's information in here about where a student has worked in the past, so their clinical history. And so if you come in here, you'll actually be able to see anytime a student was placed with you, a history of the students that you've worked with. And there's really nothing you need to do in this space, but just describing what it is to let you know. This is the view scheduled events is the area that the placement office basically records their placements with you. And you could click in here to view all of the students that you've ever worked with in the past. You do have a profile area. There is a directory of preceptors in the system. It's available to students or faculty to come in here, and you could kind of fill out this little profile. It gives us some information about you, but most of the information we have about you we already have and don't really need much more. So you're not obligated to do anything there. Those are just nice to haves and not requirements. Program resources is where we have essentially all the documents that we shared on the website are back in here as well. Occasionally there might be things that we want to share with you that are are too sensitive to put on a public website, and so they might be in this program resources page. it's likely that anything that's in here you've received in some other way, through email or in your packets. And so if you wanted to, if you lost one of those things and you thought for sure, that UW had a document about this thing, you can come into this program resources page to access most of those documents. And if you're still not finding what you need, obviously you can call or email us. And then Typhon has this little instructions section, but I think nobody could pay you enough to sit here and read through these things. So, but there is a help section here that gives you some instructional text about how to do the different things that I just showed you to do. You'd probably rather watch this video over again on YouTube, right? No, you laughed. I got one laugh. Okay, I think that's it.
But yeah, we are trying to replace that program resources section with something that's just a little more easily accessible. But yeah, we may put things like our contact information has, like the cell phone number of one of our administrators for emergencies. Not sure if she wants that just placed on the public website. So probably things like that will go still in the resources section. So just know that they're there.
Okay. Anything about what we've been talking about the last half an hour before I disappear? You're all excited to use Typhon to evaluate the students? We appreciate it.
We need to get back to this computer.
Yeah, I think I do that by going like this.
Thank you for that overview.
Mm-hmm. And then I think we have to, this is the end of slideshow. Is there more on here?
We just need the next one.
Okay. Is that this one?
Oh, I know, believe me. Okay. It's not on the, is that the Typhon handout?
Is this what you're doing next?
Yes, that's
Perfect.
Karen's. Yep. Yes, I'm usually the one who's getting the sad email about, can I get my survey back that was 90% done with? And I have to say, no, I'm sorry. So I apologize for that function. Okay, so next we're going to have an overview of our curriculum from Karen Solheim, who is our undergraduate program director. So she'll give you an overview of our conceptual model. Thank you, Jessica. You're welcome.
Hello again. I wonder how many people here have heard about our conceptual model, have had an overview of some kind. Sarah? Okay. Candy? Okay. Thank you. So I will ask you to bear with me and as we talk about this again, and also may call on you for ideas and examples of how that's fit in your setting. So we developed, or my goals today are to just explain the model we use for undergraduate nursing education and talk about how the concepts in our model relate to clinical practice. And I always do like to start with an overview of our undergraduate program outcomes. So this is what we are aiming to achieve for our students when this year they'll graduate on May 9th, 2020. So, and you might think about how these program outcomes relate to your practice setting. So, promote health and manage illness. So that's what practice is all about. Pretty easy one. Employ professional nursing leadership. We're always thinking of our nurses really as preparing them for leadership roles. Make effective use of technology. I would guess in any setting where you work, you're using perhaps electronic health records, databases, for example, related to immunization, all kinds of technology in the acute care setting. Collaboration. One of the things that's really coming to the fore in our curriculum is interprofessional education. So we work with our Center for Interprofessional Education on campus, and in the traditional program, students have a module every semester that they complete along with students from other disciplines like medicine, pharmacy, sometimes occupational therapy, physical therapy, the physician's assistant program, to name a few. And they're also undergoing interprofessional simulations. So there's two that some students will participate in this year in 436, a mock code where they work with other disciplines in managing a code. And then there's another pilot IPE simulation related to discharge care for patients in rural settings. So students may participate in one or the other, and we aim for all students to have interprofessional sims before they graduate. So that's an important focus. So one thing I think about in your settings, I'm sure you all collaborate with other professionals, but that's a great thing to highlight sometimes. What's collaboration like in your setting? How do nurses do that? Who do they collaborate with? So just something to bring to your attention. We're always teaching students to provide evidence-based care. And in this semester, concurrent with being with you, they will all be taking a 1-credit course that's focused completely on evidence-based practice guidelines. So, and we've exposed them to the community guide, or we will be, so that's useful, community and public health as well. But, you know, the goal is that we want students to use practice guidelines. I would guess in your setting that students, you use practice guidelines and evidence, or maybe evidence of from other sources. So I want you to know what they're learning concurrently, so they'll all be asked to appraise practice guidelines, to understand where they come from and how they're made, to think about the application in a particular practice setting and who they would work with to implement that. So if it's useful you to know that, you can link. And then in the second semester, they'll get the knowledge of discovery of how do nurses conduct research and what that's about. That'll come next semester. Then one of our goals here is to identify health disparities and advocate for health for all. That's if there's a way, again, for you to address how you do that in your setting, excellent. And then we want them to be good stewards of resources of all kinds, to have some idea about fiscal and ethical matters for practice. And I guess some ideas isn't the right thing to say, but really have some ideas of, again, stewardship of fiscal resources. And in terms of their learning and courses, that'll come more second semester. Students have been exposed to the concept of ethics already. So integrating that into some of your discussions is great, what the matters that come up in your setting. And then here's a broad goal. We want them to be ready to function in the community and the world. Okay, so we can all contribute to that. Okay, and so to do that, we use a conceptual model. And I could say that any type of education or all of our work is based on concepts. That's what common for us. But we've taken that idea and developed it into an intentional model for education. And so instead of starting with content, like, 5 lessons on public health issues or 5 talks on diabetes or cancer, we have shifted that we start with the concept. So I know in your folders you have a 5x7 card that lists all the concepts in our model. And there's also some definitions. Our concept list with definitions, and I see I've got to revise that handout so that part of it wasn't cut off, but I think most of the definitions are there. And that's where we start with students. So students get an overview of each of those concepts, whether it's learning about social justice, advocacy, and health and illness concepts such as nutrition or fluid and electrolytes. They get what we call the deep dive. What are all the attributes of advocacy that they need to learn? What are all the attributes of ethics or nutrition or pain? And then they get the content. And we call the content, we use the name exemplar. So concepts are illustrated with key health and illness issues or key professional practice issues. So let's just think about that. When you think about nutrition, which is a concept that's going to apply everywhere in every practice setting, what great examples might you use to teach about nutrition in your setting or to show students what's happening with nutrition? What things come up in your setting about nutrition that you might want students to know? Okay, excellent, Candy. Yeah, so sometimes if people are doing wound healing, they may need some kind of a nutritional supplement. Excellent. That's an excellent example of nutrition and how it plays out in your setting. Any other examples? Yeah, I'm just going to ask you to try to remember using the mic. I'll also glad to repeat it. Yeah.
Yes, we can talk about food deserts and the area where they work what's the options for clients to get the food and resources like that.
Yeah, okay, so that's a great example of how nutrition might be exemplified in community, is talking about the food deserts, what's available to people, and how do they get access to food. Those are really good. Is that making sense so far? Okay, so once they get the concepts, we apply those concepts to all kinds of examples. And the whole idea behind this is that students gain a mental framework of all the concepts. And then when they get new knowledge, they can attach it to the right concept. Or where they're in a practice setting, they can think, what are all the concepts that are going on here, and how do they influence each other? So, I'm thinking of dehydration. Let's see if I get this right. Okay, but, so we're thinking of fluid and electrolyte balance. If a client's dehydration, could that affect their temperature in certain ages? Yes, it might. So thermoregulation and fluid and electrolytes play off each other. And all concepts do that. So we're asking them to look at the concepts and see how they interrelate as well. So according to this model, in the literature, people write that students are better critical thinkers, and they can then in a practice setting bring all that to bear, and it helps them transfer from setting to setting, transfer their knowledge, and apply it better. So that's our whole, that's the theory behind what we do with this. And also with the conceptual model, again, we want them to use the concepts across practice settings and then across the lifespan. So how might physical assessment be different with a child versus an elderly client, and having that kind of knowledge. And we want students to be able to apply concepts with diverse populations. How might culture affect an issue with any patient or in the community? And also across the health-illness continuum. So we're thinking all the way from health to promotion to managing an illness situation. Okay. I'd ask either Sara or Candy or anyone else if you have any examples from your setting where students worked with concepts, or have anything just to bring to with your experience with our new model.
Yeah, well, I guess for myself, when we were talking about just the different things here under the undergraduate program outcomes, and we've got some things that are highlighted here. I mean, I could tag on like the flu clinics that we have in this fall. That's going to, help in management of illness, or promoting health, with the flu clinics. The professional nursing leadership. I think of the Wisconsin infant and children that we are involved in, vaccines for children, that kind of So they're in the Wisconsin Immunization Registry that we use, you know, looking up immunizations and how I'll use the student to have them look up those, you know, when we're doing WIC and, you know, so there's just, and then effective collaborating member. We do an integrated team meeting every month, and that's not just for nursing. It's all entities, whether that be nutrition, social services, behavioral health. So it's an integrated team meeting. It's not just nursing, it's all the facets, whether that be even like fitness and aquatic or, you know, behavioral health, and we're all sitting down at the table. So that happens on a Wednesday when the student nurse is there, which I think is awesome, because she's going to be able to experience that. And I see where our director also is going out to different tribes, and they're kind of catching on or modeling what we're doing there at the Ho-Chunk House of Wellness, which I think is awesome. This is my supervisor.
Welcome. Thank you, Candy. Okay, yeah, go ahead.
I guess I just have a question. It would be helpful. I was just going to ask her where a lot of us don't know where we're from or what we're doing. So I would think it would be helpful for me to know where everyone is, because I think that helps us understand where do these apply? Like some of these concepts aren't really applicable to where I'm coming from. And so, I view this as a little bit different. And so I guess it would be helpful for me to know where everyone is precepting.
I think that's just a great idea. Let's just take a pause and do that. And first of all, I want to just respond to what Candy said. And Candy, those are just great examples of connecting what's happening in where you're from in the Ho-Chunk Health of Wellness, and connecting that to the program learning outcomes and some of the concepts, like attending that group meeting. That's an excellent example of collaboration. And you talked about using the immunization registry. That's a great example of incorporating technology. And then also immunizations. We have a concept of immunity and one of health disease prevention. So that brings both of those in. So very nice. And then let's just take a pause and just state where you're from. I think that's a really good idea. Maybe your name and where you're from. And just going to ask you to use the mics if you would please try that. Thank you.
I'm Kelly Mosier. I am a nurse at UHS, University Health Services. I guess my official title is float, but I mainly work in sexual health and women's health. So that's why I was like, our role is a little bit different, regarding that. I kind of joke with students that the majority of my sexual health visits are kind of Kelly's therapy session 101. It's talking people off a ledge a little bit and providing them education regarding sex and their behaviors, so it's a little bit more psychological, kind of just letting them know what they're experiencing and engaging in is normal, and there's no shame in it, and that we're here to help them make safe decisions. So it's more of a therapy kind of, I don't know, that's what they're kind of like, you're right, you actually do a lot of talking people off ledges or letting them know what they do, rather than learning how to place an IV, or it's more that kind of role rather than the hands-on electrolyte kind of thing. So
well, I've got good news for you, Kelly. Just everything you said just relates to our model so much, and you'll see that as we go on. But in this fall, students will have concepts of reproductive health and sexuality, and I know Sean's in the course where students get a lot of that. And then also students have had a concept, a lesson where they learn about motivational interviewing, and so that probably applies. And then health education is another one of our concepts. Sounds like you do a lot of that. And I bet you have great communication skills. So there's a lot that comes into play. So thank you. Yeah.
I'm Ashley, and I also work at UHS, where I'm in community health and employee health.
Okay, great. Good to have you, Ashley. Can I out you? Say you're one of our graduates? Okay. Good to have you back.
I am Jessica, and I work at Care Wisconsin right here in Madison. So get to work with a lot of frail elders, developmental disabilities in the community, trying to keep them at home if they prefer, whatever their goals are in their health and safety, trying to mitigate those risks and implement services and supports to keep them independent. So,
Thank you.
your turn.
Okay, I'm Sara Parral. I'm a lead nurse in our Madison school district here. And we have, my role is coordinating the placement of 20 students in this course this year and next spring with our preceptors. We have 30-some school nurses, and most of them are, except our brand new nurses, and we have lots of those too, including a new graduate. That was my student last spring.
Oh, wonderful.
So we're really
Okay.
excited about sort of that connection that seems to be stronger and stronger in terms of recruiting new graduates. So we're very excited about that. So yeah, I get to really work with all of our preceptors, all of our students. It's been very rewarding and really grateful for the supports here.
Thanks, Sarah. Oh, well, you met Nikki. Okay. You don't have to talk about concepts. Okay.
I'm Callie Turner. I'm the community health nurse supervisor for Preceptor, and I oversee Toma, Baraboo, and And I'm Candy Ryan, community health nurse for Hope Nation. Have been with them for quite some time and have been here anytime there's a preceptor workshop. So thank you for that.
Thank you for coming, Candy.
My lead is Randy. I'm community health nurse for Hope Nation as well. We share the office and work with Candy. And Kelly is my supervisor.
Okay.
I'm Lindsay Muko. I work at the Reedsburg Hospital in the birth center. And so we take care of triage patients and then labor delivery through postpartum until discharge.
Could you tell me the agency again? I missed that.
The Reedsburg Hospital. Yep.
Okay.
I'm Jody McCarville, and I do the same thing as Lindsay.
Great. Okay. Okay. So that was a great pause, and let's we'll just move back to the model now. And so now I'm getting more into the nitty-gritty of how our model is organized on paper. But we have these 5 main themes in the circles on the outside that are across our curriculum. And you can see how we just talked about the program outcomes, and these really reflect that. So a big theme we want students to grasp is professional nursing leadership. The next one, person, family, community, and system-centered care, is kind of a mouthful, but we especially chose that because we want to recognize that nurses do care in some settings just for individuals, which is great. That's the type of setting that's probably more typical of UHS, I would guess, University Health Service. We want students to be thinking about families, maybe family as context for care, but sometimes family as unit of care. We've got people here who are representing community, and so the community is the nurse's client. And then sometimes we work across systems. And I just think about what Sarah just said, that she's the coordinator for 20 student placements and works with our system, represented by Jessica, to make the systems work together in terms of handling all those student placements. So nurses do that as well. Health and illness, that's our biggest area of concepts, and we've named a few here today. Then healthcare context and systems, students will be learning about different types of health systems, including the public health system, and then scholarship for evidence-based practice, which I've addressed. And then we have, within that, 80, 8 and 3 is, 81 concepts and micro-concepts. And those are the units we teach. And we just talked about that. As I mentioned, this fall, students will get all their reproductive healthcare didactic sessions. And that'll mirror really nice for those students who are working with you, Kelly, or working you with Reedsburg. So we'll get into more of that. And then I just talked about this. Meta-concepts are our 5 big themes, and then we have concepts and micro-concepts. And we use that term almost interchangeably. That just represents a smaller unit of understanding or of knowledge that a student is getting. So whether it's pain, collaboration, health promotion, immunity, those are just to name a few. And then I mentioned in your packet you have them all listed by meta concept. That's highlighted, and then you have a handout where they're all defined. And then one of our colleagues, faculty, put together this nice table, which we just use. That's not in your handout. He's got a great key, but it tells us which courses all the concepts are in. And I will mention that students get that concept overview when they first learn the concept. And then we exemplify it in different ways in different courses. So often a concept is revisited. By the time students are getting to you for their second year, they've had most of the overviews, though there will be a few new ones. So they're getting the revisits where there's different exemplars. Maybe they're more complex. Maybe in the first year for tissue integrity, they learned about skin assessment, they learned about decubitus ulcers, but now in their second year, their exemplar is about burns, for example. So it increases in complexity, or with a different type of client. For example, we revisit advocacy. They get that early on, but now in this year, they may address that at the community level. So it's different that way. And then here are our courses. And I mentioned most of the second year, first semester courses. We always have a health and illness course each year where they get a lot of the health and illness concepts and exemplars. This year, their fall health and illness is a 5-credit course. It's quite large. Every semester, they have 4 credits of experiential. So they'll be getting that with you. And one course I didn't mention for this semester is our course, Social Justice in Local and Global Settings. So social justice is an important concept in our curriculum. This is where students are going to talk more about access to health for everyone. Talk about how clients' personal identities regarding their culture, their sexuality, their gender influences their health practices and nursing care for clients with unique identities. We also want students to have some appreciation of a global perspective. That doesn't mean they all travel, though some do, but that they can think that, hey, climate change affects the health of people everywhere. Or what might health issues might people in our local community face that are also global issues, like adequate nutrition. So we want students to gain a broad perspective on healthcare issues and to focus on those health equity, social justice issues. So that's what I'm going to say about the courses. And then just, we talked about exemplars, but here's a couple of examples. And for one of our texts by Dr. Jean Giddens that we use has that whole book is focused on concepts and overview and the concept overviews and then different exemplars. So that's where some of these came from. So when we teach collaboration, we're breaking that down. The exemplars are these smaller components. What's nurse-client collaboration like? What's nurse-to-nurse collaboration? And give some examples of that. And then here's some different exemplars that might be used with infection. And you can see that these might represent the lifespan. So otitis media, common in kids. Influenza, of course, all across all populations. Human papillomavirus, I'm guessing, Kelly, you probably talk about that. And some more concept of, in terms of protection with young adults. And then UTIs manifest often very differently in older adults. So how do we deal with that? And then, as I mentioned, we want students to think about how concepts play off each other. So here's an example here. Collaboration can't occur without good communication. And for care coordination, collaboration is absolutely necessary. So we're helping students make those connections. And the same with health and illness. You can see infection. If tissue breaks down, it's a setup for infection. Stress may be a causative factor in infection. Certainly, people need good nutrition to heal from infection. So then our teaching strategies in our classroom courses or the didactic, we use a lot of active learning. So students really get their kind of apply the information in class, work with it. And that's based on contemporary science about learning, is that students make the brain connections better if they work with knowledge, if they are able to apply it. So we do that. Sometimes faculty do lecture too. We try to keep those short and always include some interaction and so forth. Then students have a fair amount of lab and simulation, and Julie Patrick's here going to tell you about that soon. And then, as I mentioned, they have 4 credits in practice settings every semester. And then in clinical, in the experiential settings, sometimes faculty do use concept-based learning activities where students might be not caring for a patient at a certain time, but participate in a group learning experience that shows how a concept plays out with different people or in different settings. So we try to integrate the concepts into some of the clinical, and Julie has other ways of doing that, like care plans. They center their care plans in the first year around concepts. And then as they get into their second year, then they're doing more of that integrative experience with you, getting more of a view and feel and experience of what a nurse does in your setting. And then this is just something I put together of how you might think of addressing concepts in the practice setting. First of all, I want to let you know that dealing with concepts is our job, okay, so as faculty and at the school. So we don't expect you to be a concept master. But at the same time, I hope you'll look through the card and look through the definitions and look at the learning outcomes to think about what role you might play or how it fits for you. So one way to go is just to ask students what concepts they noticed in a setting and how it fits to what they're learning about different concepts. And then you can always link. You probably all have salient experiences in your setting that you want students to be a part of, whether it's an immunization clinic, attending an interprofessional meeting, and then if you can make links to a concept, great. It's a way to reinforce the conceptual model with students. Another way you might go is maybe you as the preceptor is saying, well, here's this young child in the school setting with diabetes. There's nutrition issues. There's development issues. What other concepts do you see? You might ask the student. If a patient comes in with, let's say, human papillomavirus, great time to ask the student, what concept does this represent? So so those are just some ideas. Let me see. When talking about a concept, like trying to pick a new one, just ask the student how they've seen that, how they've seen elimination play out in the acute care setting, how is it with this client at home, just different, exploring how they've seen it before. And then interrelate concepts, we've just talked about that. And you can always explore different things as they relate to the concept. So those are just some ideas. I think sometimes it's hard. I just want to see if I can foster helping you make the connection. So that's what I have to say. I will point this out. This is in your plan, and starting in January, depending upon Nikki's role with you in making assignments, some of you might have students in our accelerated program. And if that starts in January, you'll have different learning outcomes, but all the conceptual model is the same for the accelerated. So if you get students in January or in the spring term, the same conceptual model applies. Okay, I'll just stop for questions or comments that people have, and later we'll have an activity of looking at some of the concepts at play at your site. Okay, does it make sense enough? Okay, all right, well, thank you. Oh, I can take my slides.
Sure.
No, they can have a break. That's right. They need a break before.
Yeah. So we're back on schedule here. So we're scheduled for a break until 10:10, and then we'll come back with Julie to explain what the students did during their junior year and what they're able to do going into their senior year. So we'll see you back here at 10:10. Okay. Oh, there is still fruit, I think, and some other nibbles out in Enroth if you're hungry.
So it's we need to discuss some of these like screenings or how we can work together. I thought it would be good for if you're able to come to talk about how you can how we go. Right, we can't do this. Okay.
Maybe we can meet.
I mean, if Nicky kind of knows the kinds of things you're looking for, it's really kind of a broad kind of screening meeting, but then also to look at how else we might be able to use the Dean Health places for workshop nights and some of that stuff. Okay. It's going to be probably potentially a spring, but more likely a next fall kind of thing, but to get all of them is works in progress. And I had just kind of mentioned that, you know, if we could get that together. Yeah, and then, I mean, my plan is to kind of hand it off to Nikki and kind of what we are looking for, so she knows what I'm looking for. Then I think it just makes it a little bit easier. We had thought we were going to get to the point of maybe having some screenings this fall, but it didn't happen.
Hello. I don't think you do. No, it's community, and their Ho-Chunk Nation is here. They probably have a bit. Yeah. And we're just taking a break right now. Okay. But otherwise, that's why we thought we'd come from the schools. Yeah. 2 UOB and 2 from university. Oh. So
Yeah.
so
much, yeah.
you can come to lunch.
Just pop in for a bit.
Yeah, it's hard after this. It gets back to
Yeah. So what time is lunch?
And especially, you know, they're scheduled to work.
Is this Karen's computer or is this?
This is the computer.
Okay.
And I was gonna pull up some of my stuff on the
Can I? Is this your flash drive?
I don't know who that is. Oh, is this not your talk?
Oh yeah.
Okay.
Okay.
Yeah,
They told me they weren't going to have it on the computer.
Yeah, I don't know how to get it to the computer. And
Last year, I really didn't do that. No, and I don't think JJ will.
and we can always call. So I tried this, but it didn't. Oh, I wonder if I have to close mine out better. Let me try that.
Appreciate it. Thanks so much. Yeah, thanks for coming.
Okay. So
They're out. I think they're out.
We can come down at lunch too. I noticed that we were both in our fall color patterns. Yes.
that did help. Okay.
Where that is.
No. You could close that one too.
Okay. sure where mine
Oh,
is here.
Yep, there it is. And then, and now it's up there.
Okay.
Great. And then you know how to make it expand, right?
No.
And your resources are up.
Oh, awesome.
This is just in the PDF, not my PowerPoint. It's the PDF.
Oh, would you rather use the PowerPoint?
Keep your head around my office doors, man. Like,
Because that's how I sent it to them.
Did you want to mute that? I don't know what's that.
What?
Did you want to mute that?
Oh, sure.
Hello? I think most people are starting to trickle back in. So I'm Julie Patrick, and I understand there's some people joining us online, so hello. My role is the clinical coordinator of the junior level instructors, and I was asked to present today on kind of the down and dirty, what can they do, what can they not do, what maybe have they learned but they really don't know how to do. I apologize, I didn't know you guys wanted to do a care plan with me like in the old days of nursing school, concept-based care plan. I didn't prepare for that, but I'm joking because Karen was like, Julie does this in care plans. I'm not talking on care plans. I don't want to disappoint you all. I know you remember those fondly from nursing school. So we're just going to talk a little bit about what students can do. They should be fairly proficient in your basic cares. So, vital signs and bathing and hygiene. Now, we do not have a requirement here at the School of Nursing for them to come in as CNAs. And I don't know if everybody is aware of that. So that is not a requirement that they've taken the course No Practice as a CNA. So all of that stuff we teach in that first year. So some of them may be very comfortable and some may still need some assistance, especially if it's like a lift device that is specific to your facility or whatever. And I don't know how many of you are in home health and how many of you are in acute care. If you see a student struggling with some of those basic cares, it's fine I think Jessica just left. I think it's fine to have them shadow a CNA for a morning or an afternoon and get more comfortable with the idea that to delegate, you need to be comfortable in doing that. And so if you find that's an area, I think it's okay. You might want to just reach out to Jessica and say, hey, just a heads up, this person is having some problems, so they're going to spend, a shift with the CNA, so they're comfortable with that. But for the most part, I think our students are at a pretty decent level. They may need some reminding on, donning and doffing in the order or what isolation type is what. Most of the facilities have, the signs that tell them. So that's kind of the things that they should be able to do. They may not have shaved a patient or they may not have done some of the things that not necessarily get done frequently. So that's kind of where they're at for basic cares. Additionally, they have learned full head-to-toe assessments. I would like to say they should be at an advanced beginner or even almost a proficient level in doing it, but sometimes they don't understand what that finding means. Like we've talked about edema, or they don't know that, like a +1 from a +2, those kinds of things. They might come to you and say, I don't know what this heart sound is. It's not like what I've heard before. But they should be able to recognize it as abnormal. And where they're at. And they should be able to respond to a patient with a complaint. So if the patient's having abdominal pain, we would expect them to do a focused abdominal assessment. What they tend to do is get really focused on the objective data and miss all of the important history parts. Because they'll come and they'll be like, well, their abdomen is, firm and blah, blah, blah. And you'll be like, when was their last bowel movement? I've totally missed that part of it. But then if you key them with well, what subjective data what did you ask the patient about? Sometimes you can get them there. And it's usually just, one or two of those times, and then they're right on board with things. It's just getting them refocused to the big picture of things. And they may also struggle a little bit with their flow. We've worked a lot on it, but sometimes they get really focused and they forget to check pulses when they're checking cap refill and that kind of stuff. They come back a little bit. They also may struggle a little bit with the documentation part of it, and some of that just goes to each facility having their own within normal limits and all of that kind of stuff, and having an understanding of what that means. Any questions so far about the first couple? Med admin. So they have learned the routes of med admin. We focus very strongly on the 5 rights 3 times, which means they'll check their MAR and all of the rights 3 times, which can be cumbersome. They may be doing it aloud because they're used to an instructor watching them. So you may have to say, hey, you can do that in your head now, and then they're okay. So they all have given oral. They've all done a flu shot clinic. They should have all done sub-Q. They may not have all used insulin pens. We have some facilities that use the syringes. So they may have used pens, they may have used syringes, they may not have done both. And they should have all done IV routes. They may not have gotten both a push and a piggyback. And again, they may struggle a little bit with the pumps. Our goal is to get everybody all of those experiences. And in order to accommodate that, we're actually changing sort of the flow of the course so that we can start IV meds about week 3 of second semester instead of about week 8. So that should really help us in fixing that. But they may not have done, used a central line and a peripheral line. They may have done one of the two. And we do work on talking through the differences and we practice on it, but again, they may not have had both of those opportunities in a clinical site. So that's something you may see. They also may not have had a ton of experience. It depends on the floor. If they were on a respiratory floor, they will have done a ton of inhalers. If they were on an ortho floor, they may have never seen an inhaler. So it just kind of depends on where they've been. What I think you should know is they all have access to an online skills module. And so if they're getting ready to do something with you, it's fine for you to ask them, so what are the steps? Or refer them, better yet, to your policy and procedure at your facility and give them a few minutes to talk through that with you. But if you're like home health or something, you might not have those resources. They can log in on their devices, take a quick look, and talk you through what they're supposed to do. So if they say to you, I've never done, an enema, and they're like, well, you better be ready for it. Those kind of things. And I would also encourage you that if there, is some things on your unit when you're reaching out to your student, you might want to say, these are some common things if you haven't done. We do a lot of nebulizers in this home health unit. So if you haven't done a neb, please review it before you come. Or we insert a lot of catheters. Will you please review it so that you come prepared? That's absolutely fine for you to direct them that way, that what they might see or do more on your unit. We do a lot of central lines. We don't see central lines, that kind of stuff. Again, other procedures, they've been taught in the skills lab. They may have not had an opportunity on a real patient. Again, depends on the unit. Insert or removal of an indwelling catheter. Again, we don't see them very often anymore. If they're in for 24 hours. So our students are not getting a lot of practice on that. They may have had some straight cathing practice, more likely to have had that. Central line care, again, a lot of facilities have gone to, 2 RNs and watching each other. So we've practiced it in lab, they wouldn't have done it. So it depends on your facility policy, whether you have a team doing it, but we don't really have a lot of opportunity to practice it in some of our facilities because of the way they have teams and stuff doing that. But they will have practiced that. They will have practiced blood draw. That we will have talked through removal of a PICC line. Again, depends on your facility who's doing those kind of things. They will have practiced IV insertion, but not done it on somebody most likely. We don't let them poke each other at the clinic here at the clinical site. So they may have done it at clinical. It's the first thing we teach in the second semester. But again, we tend to be doing that less often because we don't have the, change it every 3 days kind of some of those policies anymore. They will have been instructed on tube feeding and G-tube meds. That was way early in their first semester. And again, if they're not on a unit that sees it, I would encourage you to say, hey, we're going to have a lot of G-tubes. You better take a look at the differences. And again, we talk through inserting and removal, not something that comes up very often for a student in the clinical setting. Many of them will have had some opportunities to do wound cares and dressing changes or observe it. They're not very good yet with sterile technique. Even putting on sterile gloves takes them a while. It takes a lot of patience from all of you, and we appreciate that. They've done it multiple times, but then they get all sweaty hands and flustered and that whole thing. And probably not a lot of sterile dressings changes, but just normal kind of dressing changes, irrigating gas trace and that kind of stuff. They may have done some blood glucose monitoring. We've gone through the procedure here. Again, we don't have them poke at each other. So, and many of our facilities do not have our students doing it because of the quality control and the whole processing. We have some facilities that do allow them to do it. So again, just talking through what your procedure is and how to do it. Ostomy care, if students have been on certain units, they'll have tons of experience. Many of them will have had none. Even like emptying a bag will have not had experience in that. Trach care and suctioning, we cover it. We do it on the mannequins. Again, not something they get a lot of practice with in the clinical setting. I had my students on an IMC unit, and most of the time for trach care and suctioning, I deferred to RT and to the staff there, just to make sure that things were being done by their policy and procedure. Sometimes it's really hard to keep up with which facility does it how and all that kind of stuff. So, administration of TPN is covered in the didactic course. They talk about it with nutrition. We're just adding it this year because it really hasn't been covered, so they really won't have, for you guys this year, they won't really know much about it. They'll know the book side of what TPN is, but the lipid component and how that all plays out will be incredibly challenging for them. And blood administration, per Wisconsin state statutes, students cannot be the second checker on blood admin. They can certainly observe, and once you've built a relationship, if you want them to stay with the patient, that's okay. But they can't do that. We have, again, talked through it didactically, what a transfusion looks like, and we're going to incorporate it into the skills portion this year so that they see what we should be doing with a check, with checking blood and talking through those transfusion reactions. But this group will not have had that yet. So anyway, we tell the student to check their facility policy and procedures. That's like where we send them all the time. Feel free to do that. It's good for them to know that, that sometimes you have to reference those things and you don't know everything and whatever change, that's an okay thing. Review the skills verbally with the students. Ask the student to explain what they're going to do. Sometimes you have to coach them a little bit. Ask them if they've done the skill just in lab or on a real person. That will help you in knowing kind of where they're at. And again, they have access to online skills, so feel free to send them to that access and expect them to look stuff up, and then just defer to your facility policies. Do you have any specific questions? Like, can they do this? Did you teach them this? Or any comments? For me as a coordinator on things that maybe you've precepted before and seen some areas of weakness that, hey, it'd be really nice if you focused on this more because we're struggling with it. I'd be very happy to hear what our challenges.
So just
We are in the OB Universe Center.
Oh.
So they are learning about that this semester, is that correct?
Yes.
Yes, they are in this course. It'll be the first 6 weeks after the semester. Yeah.
And they do a sim, a birthing sim, correct?
Yeah.
Not till the second rotation.
Okay.
That's in November.
So in November they'll do a sim for it. Again, they'll have had the book and watched the videos, but it's a little different. So good question. And probably, we touch a little bit on epidurals, but like they don't get a lot of that. We talk about it from a med safety perspective. And again, that's really kind of unit specific, so we are very general. They probably will have a hard time with that when they come to you. Other questions? Anybody joining us remotely that has questions? I don't know. Oh, okay. Okay. If you ever have a question, it's okay to say I need to check. Like, will you watch me today and I'll double check that? Feel free. That's okay. They've had all of their skills. It's just a matter of taking it from a book and doing it. And we're really trying to focus a little bit less on step 1, step 2, step 3, and get them to, well, why are you doing it? Why does the order matter? And paying attention to, I just, touched my hair, now I have to put on new gloves. That kind of stuff. That's what we're trying to get them to be thinking versus 1, 2, 3, 4. Because as you know, whenever you're doing something inadvertently, something happens and it ends up changing. So,
how much independence do we give them?
I'm going to defer that to Jessica Colburn. No?
And this kind of gets to the heart of why I had Julie come in and talk to you, because I think, students are very cautious about, not wanting to overstep their bounds, but we also don't want to run into the opposite problem where they're, scared to do anything. So I think, utilizing Julie's list of what kind of things they're coming in for, and then just looking at your policy in terms of if your facility has specific policies about what students can do. And like Julie said, asking them, and also, just watching them the first time.
Yeah, and I think that it's really up to your comfort level in the students. You're going to have students that are like rock stars, and you're like, okay, go ahead, do this assessment after, being with them for a shift or two. And there's going to be other students where they're going to need more. So you have to base it on what, and then, let us deal with the complaint of, well, they're not letting me do this independently. Let us take that on. Send them to us, and we can, we trust and value your input and your direction, and we want you to remain safe and all of the patients and students to stay safe in clinical. So we're going to defer to your expertise as clinicians, always. That's so. And don't believe everything they say. One of the questions that has come up for me as a first-year coordinator, and I'm looking again for some input on, is we're trying to juggle as instructors with 8 or 9 students in a group how to have students take more than one patient, because it becomes very stressful for the instructor all of a sudden having 10 or 12 patients with 8 students. And we're wondering what you're thinking expectation-wise. Some of the feedback I've heard is if they can take care of one, we're ecstatic. And other people have been like, no, we'd like them to be able to do more than that. And we're trying to talk that through and work that through as a faculty, how to get them there. So any input you have is great. It's hard if you're on a unit where nurses are taking 2 or 3 patients and you're expecting students to take 2. That's unrealistic or after first year. If you're on a unit where people have 4 or 5, and it's a 24-hour stay, you might be able to do that occasionally. But any suggestions? Good luck with that? No.
Just as far as community health nursing and home visits in the community, I try to just tag them with 1 or 2 clients, so they have that continuity.
And then they can
that long, and so that if that person isn't available that day when they're there, then maybe we can use the other person.
Sure.
So I usually just have 2.
Okay, that's good to know. And I know in some of our high acuity units, they're obviously not taking more than 1.
And the other challenge too in the second year is that they go back and forth between community settings and acute care settings. So, you might get a student come January who's been in 2 community settings and now they're in the ICU. So, there's a high amount of variation in the settings. And so in terms of working up to where we want them to be at graduation, it's always a little tricky. So I guess that's why we always say base it on the individual and of course, what you've seen them do and are comfortable with. We know these are short rotations. That's the other thing. So of course you want them to, become a little bit proficient, but you're also dealing with a short time frame in which to do so. So just please know that we understand that and that, we don't expect you to get somewhere by 8 weeks that you normally would get to in 16.
And I would also say, if you're noticing some areas of needed improvement for a student, again, reach out to us and let us help them through and work with them in lab or whatever kind of things that you're noticing, so that we can help them be where you need them to be. We have those resources available, and we don't want students to struggle, and we don't want you to be frustrated. And sometimes it's anxiety and nerves, and sometimes it's, haven't been in acute care in a little bit, and we just need to give them a little extra support. And that's our job. Mm-hmm. And we want to be able to do that for you and be part of that.
Yeah.
Yeah, I'm just always nervous that I want to give them their freedom because that's exactly what I wanted to become a better nurse. I need my own wings. I can explore on my own type of thing. But I don't want them to view me as them as a workhorse or something they're taking a load off of me. that's kind of
Yeah.
where I'm at, and I also don't like to lose control of things
Right, yeah.
too.
Yeah.
Yeah, I mean, it's amazing how little things can be so empowering to them, though. I mean, just as, like, and again, it depends on your facility whether students can administer meds by themselves or not, or if you have to be there. But going in, you do the big med pass with them, and then later the patient's asking for Tylenol. They like skip down the hall to give 2 Tylenol because they're doing it by themselves the first time. It's just, and you're just sitting there like. And they were like, I felt like a nurse today. And it's like, great, just because there wasn't that. So again, you can take that and do what my personal philosophy, I don't let them do parenteral meds alone because that's a whole different level. But if you're somewhere that does, flu shot clinics and they've done how many of them, and, again, that's really empowering for them. It makes them feel really good. Any other questions
Any other
I can answer?
questions?
Feel free to reach out to, I don't think they have my email, but you can certainly share that.
Sure.
Feel free to reach out to myself or Jessica if you need clarification or if you want to know how we taught something because it's feeling, what did they say to him? That kind of stuff. So happy to answer any of those questions.
Yeah.
Are you next?
Thank you, Julie. I am next, so I don't know if I'll. Okay.
I wasn't sure what you were doing.
I'm just going to pull up my slides here. Sure. Do you know how to turn this music off? It's still playing.
Let me see if I can. Nope, that didn't fix it. I don't know. I thought that it was what came on with lecture.
Okay.
I don't know.
Okay.
Sorry.
No biggie.
You want it back on pre-lecture?
Yeah.
Trying to turn the music off. Does it work here? Do you want me to have someone come turn it off? I can get the key.
Yeah, that would be great. And my back. How do I get this so that it's not showing the right tabs? I know. I still can't bring up my PowerPoint it's on the desktop. Okay. Can I help? Yeah, I can't bring up my PowerPoint. Okay. One of these tabs is
Is this yours?
which is fine. Okay. Can you turn off the music and then I can't get my PowerPoint even though it's on the desk?
files on the desktop, but it won't open.
Yeah, look. Well, it'll open, but it shows all the tabs on the screen. Do you see?
Like a presenter view.
Yeah. This is what I was trying to. This is my PowerPoint, but I don't want all the tabs showing up. I just want the show.
Yeah. Is it all enter?
And is that music?
PDF? Yes.
So I saw students like, not as good. Yeah. Yeah. Traffic yesterday was stupid. I was like, what's going on? Like, what happened in your visit? I was admiring that way. I was like, I just need to get left. I need to get to my work area.
Hold there for a second. I'm trying to make a quick switch.
I know. Yeah. It's crazy.
Steps.
I mean, it's not that big of a deal. It's just, it's a PDF because it's a handout.
Right.
For whatever reason, I scored the jackpot. But like, I put it in over, and I was like, wow, what happened? And like, literally, like, I'm like, how? There's just spots every, like, I was like, what's going on? So like, I literally go in harder, and like, so like, that like just saved me.
Well, that got rid of the tabs anyway. Do I have to like scroll through it then? Like
yeah, everyone. Or in like I need it and like I think
it's not on there in PowerPoint. It's only on there in a PDF.
Can we open it with a? But I mean, this will advance it.
Okay.
But
great.
Kind of not in a slide setting, so you can see the little overlapping parts.
Sure.
Which one is it here?
It's this one.
Can you imagine? Can you imagine if you like didn't get like? Well, I know she knows that. Like, I think she parks up at the full center because she. But I was like, I don't have time for that. And like, also when it's polar vortex, I'm not gonna like, no thank you. I can really.
Can you try that one?
Yeah.
Okay. Does it work?
Yes.
You don't have your notes. It's okay.
Like I don't get.
Okay.
But
on YouTube.
I don't need a full screen on there.
Okay.
The music is off. Right.
Thank you. Okay. Hello. Who knew that saving something as a PDF would cause this much of a fracas? But we're back. Okay, so I'm going to talk a little bit about the course that is associated with your students for this fall. And so I'll talk about N436, which is my course. And I guess since you're here, just know that the spring course is very similar to this. It just has a little more complex learning outcomes that are moving across our curriculum. But in its format, it's generally the same. People have preceptors, we do seminars. The things I go through in this slideshow will be what we do in spring in the 446 course, and we share preceptors across these courses. So as I said, between the two courses this year, students get 4 different placements, and those can be in a variety of situations and sites. So We show this to the students at the beginning of our course too. These are our professional standards. And I put this slide in there just so that you all know, and you can explore on our website if you feel like it. And we can link to these on my Preceptor website. But these are the professional standards that we have for our undergraduate students. And if you ever have questions about student standards, professional behaviors, please know that you can come to me. I know I keep saying that, but we really, really want to have an open door communication policy. It's student-centered. It helps our preceptors. We want to be able to support our sites, and one of the ways we can do that is to always have an open communication policy. Sometimes we get to the end of the 8 weeks, and I am reading through evaluations, and I have many surprises about students who were late or didn't say that they were not going to be coming that day, or didn't show up wearing the uniform that the site has asked them to wear, etc. It's just disheartening to find out at the end. I'd rather be able to do something about it, and more than that, I don't want sites to think that those are the type of behaviors that we endorse here at the School of Nursing, because they aren't. So if you ever have a question, please just let me know, because I'm happy to back you up. I'm happy to reinforce our standards with students and let you know additional information that would be helpful to your practice and your site. So this is the description of our course in the fall. They spend time in 2 settings. They started out, I think, as Julie said, focused on individuals last year. We expand that out into more families and communities. And so they're building on their previous learning, and they're building on what they're learning in their didactic courses. So in my course, really what we do is augment what you're doing in the clinical setting. Since they have preceptors and they don't have instructors in the clinical setting, we do the part of that would normally be done by instructors. So we do things like clinical debriefs, we do prioritization exercises and various active learning activities in our seminars, just to augment what they're doing in the clinical setting. Now, this is a little tricky because, and my numbers didn't show up on here, but as you can see, about half of our sites are inpatient, sort of acute care hospital settings. And the other half are split between population health, community health, and outpatient settings. So as you can imagine, when we're in seminar trying to have all these students who are in all these different settings and have learning activities that pertain to all of them, it takes a lot to plan activities that are pertinent to all these different settings. However, we know that typically over the course of the year, the students are going to be ending up in each type of setting, usually. Basically, the point here is, though, that we can't plan things based only on acute care settings, because that would leave out half of our students. I think it just stopped because of that little box that showed up. Oops. Okay. I can use the mouse. Here are the learning outcomes for the course mapped to the AACN Essentials. We just like to go back and remind our students and let you guys in on how we determine the course learning outcomes for this course. They're all based on the AACN Essentials. And so they're mapped back to those essentials, and students have this information as well. So these are the learning outcomes for our course. And the reason these are important for you is that this is what the evaluation is based on. So the evaluation in TIFON is based on these learning outcomes. Again, we have all different kinds of sites. Our learning outcomes some of which are more broad than others, some of which are, pretty specific, and some of which, you feel may or may not apply directly to your site. They're encompassing a lot of students in a lot of different settings. So I think that's one thing too. What I would say to preceptors is we work on making sure as the faculty that we cover all of these objectives in the course. So in the work that they're doing with us here at the School of Nursing, we are sure to cover all 6 of these. So if there's something that you don't feel like you're specifically seeing at your site, always contact us if there's any way that we can help you sort of feel like you're integrating that. But 2, please know that they are all covered in our seminars as well, so that each student is getting each course outcome covered. So, for example, when we look at number 2, social justice and culturally congruent care while developing a global perspective. So we have a seminar that's about global and local community resources. So that's one example of how we're specifically bringing in a course outcome, making sure that we're covering that in our seminars, and hopefully they go back out into their settings and can sort of integrate and apply that knowledge in the setting. But I think one of the questions I get from preceptors is, not all of these seem to apply to my setting. And we understand that. And so that's why, we're doing our part here to cover all those and also augment what you're doing in the setting. But we also think it's good that you're aware of what our outcomes are so that you can, sort of be thinking of them and knowing that they're on the evaluation and thinking about, how you can connect those things, at least on the evaluation. But please don't feel worried if you don't, feel like you're covering each and every one of these, because that's our job to make sure they're all covered in the end. But that is what our evaluation is based on. So. Okay, so this is in our syllabus too, and this will be in the letter that I send out tomorrow, is our injuries and incidents reporting. There is also, emergency numbers listed on our preceptor letter where you can call if there is an incident during clinical. We've had this happen. This is not unusual. Things happen at clinical, and we just, again, need to know about it sooner rather than later. As soon as everybody's safe and the student is safe, please report it to us. There's a form to fill out. The other thing to know is that students are eligible to go to University Health Services for any follow-up. So I'll give an example. Last year, a student got a concussion, fell and hit their head at clinical and had a concussion. So it was important, that we coordinate with the site, make sure that the student had a ride, could get to UHS to be seen, and go from there. But, it was very easy in that case to work with the site and work with the student. But after that, I always wanted to be aware that, the students have these resources and that we have resources, whether it's, coming to pick them up literally and bring them to the clinic, or anything else that they would need. So the letter will include not only the office number here for daytime hours, but our emergency number for night and weekend times too. We're always available if there's an incident with the student. So unfortunately, this has also come into play, and so this is right in the syllabus for the students, and this is something that we want you to know what our expectations are for students. And again, this is in the letter, but it's worth repeating, knowing sooner rather than later if there's a safety or behavioral problem that we need to deal with immediately. Please give us a call. safety is of the most importance to us when the students are out in the clinical site. So safety for patients, safety for the situation. But, you know, we have had students who have had issues with this, and, you know, again, it's come to us. This is what we do. We're here to support students. We're here to support them even when they're having a problem or failing. Like, we have many, many mechanisms to help support students through all kinds of situations and in the clinical setting. But please know that we back you up, and that these things are unacceptable and we need to know about them. And we work with the student on our end. But again, just knowing our expectations. Our statement on diversity. So I'm going to talk a little bit later about a safe and inclusive learning environment, but this is another statement that goes in our syllabus that all of our students are aware of in terms of understanding that diversity is an ongoing process, that we're all learning, that we're all working to ensure equity. And as I said, I will discuss this a little bit later in my comments that are really specific to diversity. So here's a list of the other things that we do in N436. As I said, we have seminars, we do large group, we do small group. There are, let's see, about 75 students in each section. So when it's a big group, it's pretty big, but we try to break it into smaller groups and do clinical debriefs, case studies. We do prioritization exercises. This is something that students just can't seem to get enough of, is here's your patients, like, what are you going to do first? Who are you going to see? Why? We really try to work them through the process of clinical judgment, get them to not only be able to, you know, talk these things through the process, but write about them. We do specialty topics. So, for instance, in the first rotation, we have a seminar on rural health specifically and rural nursing. So students who aren't in those settings can get an idea of what the particular challenges are in those settings. Simulations, as we mentioned earlier, we are doing a birth simulation in the second rotation that all students do. We have, we have a mock code, which half the students will do in the first rotation and half of them will do in spring in the fourth rotation, which are interprofessional, which is a nice opportunity for the students to work with medical students and pharmacy students here on campus. We do a pediatric home visit simulation. We have a simulated apartment upstairs, and so we do a simulation that's typically a home visit, I think, for breastfeeding support, which is nice for students who, again, may or may not get to do any home visits or, that type of community activities. And then we do a standardized patient experience also in the fourth rotation, which is over at the UW Sim Center, utilizing an actor who is playing a real patient in the room. Last year it was the actor was a parent of an adolescent who had received an opioid, not overdose, but too much of an opioid. And so it was great to see the students, interact with this actor who was the family member of the patient, because the patient, wasn't responding. And so the point of the simulation was that they were learning how to interact with family members during a, kind of a crisis situation, along with medical students and pharmacy students. So they get some pretty amazing simulation experiences while they're here, and they seem to get a lot out of those. But that one especially, I got to facilitate on some of those, and it was pretty amazing to see the students do that type of learning and then debrief in that situation. Let's see. So then in our course, we also have self-directed hours, which I referred to earlier as flex hours. So they get 3 to 6 hours per rotation where they can do something that interests them that meets the course objectives for the course. So some students will do extra hours at their site if they're available. You know, some students are really into what they're doing at their site and would just love to get extra hours. So some go that route. We have a lot of opportunities on campus for things like lunch and learns and seminars and interprofessional learning activities, lectures, etc. So students really get a chance to choose what they want to do and how they want to fill in those hours based on their own interest. So just as preceptors that they could potentially ask if they can do a couple of extra hours. We always tell them, though, it's not guaranteed. You know, your sites have agreed to 64, and if they can't offer more, then that's fine. You know, be respectful of that limitation, and that's totally fine. But otherwise, yeah, they may be doing some other things that are of interest to them. So those are all the activities we do in our course, besides what they're doing on site with you guys. Oops. Okay, so I'm going to talk just about assignments a little bit, only because some preceptors like to read their clinical journals. Some don't, and it's optional. But students do write 4 clinical journal assignments during an 8-week rotation. And typically, we have them email these to their preceptors, and then if the preceptors choose to read them, that's their option. I was going to attempt to bring up the assignment on this computer, but I don't think I'm going to try to do that because we don't need another 20-minute break. But basically what they're doing is they're working through a series of questions to look at both the course objectives and their clinical judgment. So we have 2 forms of the assignment, one that's geared more towards a community setting and one that's geared more towards the inpatient setting. And we let them choose which one they think is more pertinent to their specific situation. So if I'm thinking of the questions, they start with, sort of what was your priority today? Like if you were in the community, what did you and your preceptor talk about doing, and what did you do? And why was that a priority? And then working through, next steps. So what types of interventions did you do? Or what types of health education did you do? And just working on down the line. And in the acute care setting, it's the same thing, except more specific to, what were you worried about with this specific patient? What was, like I said, I could bring those up. I will try to put those assignments in a place on the website where you can see them. But I guess the important thing to note is that students are expected to look at this HIPAA reminder in their assignments and not include any of these 18 possible identifiers in their journals. And so they're well aware of this, but I wanted to mention it so you could be aware of it too. I always encourage students to talk with their preceptors about their journals or what they're going to write about, or, if there is a moment, which I know sometimes there isn't, but to talk about prioritization or talk about the clinical judgment process, because obviously it's second nature to you at this point, but for them, we're really working to try to get them to integrate this process into their mode of thinking so that by the end of the year when they graduate, this is just the way they think. So as I said, I encourage them to be open with preceptors about what they're writing about. I encourage you to read their journals if you have a chance. But if not, we understand that too. We are reading them. So that's the other thing to note. That's our way of sort of connecting with the clinical site and what they're doing at the site and sort of checking in with them to see where their thinking is at that moment. So again, I apologize that I don't have the actual assignment up here. We really talked a lot about evaluations, so I don't think I need to go through this much more, except that those dates will be in the letter that I send out, and that we're always happy to help out with any problems or issues that come up before evaluation time. So, for example, if your student is chronically running late or has absences that we should know about, please let us know. It's noted on the evaluation, but again, easier to correct those behaviors earlier. So thank you. We have other things to cover, but I just did want to say a big thank you for being a preceptor. We know that we could not run this program without you. Do you have any questions about the course? Okay. So I am now going to turn it back over to Karen, who's going to talk about the nursing concepts across settings.
Thank you. Okay, and we have two exercises to do in the next 30 minutes, and I think we can do that. And the first is an exercise about just playing with the concepts that off of that 5x7 card you have or the list, and just highlighting how some of those come out in your area. And we have a choice here. We can work in groups. And actually, I see a group at Ho Chunk. I think that's a nice group there. And then we have two people from UHS. And maybe you could join with the UHS group, and because a community group. And then we've got people focused on perinatal nursing. And so you will make a perfect group. And I've got these handouts that have just some ideas of of concepts and how they might play out in a setting like yours. So the whole purpose of this is just really to brainstorm and think, okay, what does our practice, what concepts are really showing up in there? And there's no right or wrong, but just to, I don't know, get used to the thinking about it and help you out in identifying things. So I'm going to hand these out, and then we'll take probably about 10 minutes for you to work on that, and then we'll join together and just see what you came up with.
So here are some handouts. Jessica's going to join with me. Right. And then, sorry. And then, oh, that's not. Oh, okay. That's not. Get your hands off. Okay, we're there, yeah. And then, yeah. So there should be one for each group there. Oh, that's right. Yeah. Okay, here you go.
Yeah, sure. We're all inclusive. Yeah, so I think it's all great. Yeah. If there's a problem, just right.
It would be pretty easy for our side.
Right, yeah, you wouldn't have to go far.
Right. Yeah, yeah. Oh, yeah, she works with me.
She works with
Okay.
her, yeah.
I'm at
Yeah, they are.
supervising.
Yes, and so was the care group, was there a discussion like pertinent like the Center for Aging and Research, like resources and stuff?
Yes. Yeah, so typically a member must wait here like and there's a workshop that is completed which shows once they are then essentially
That's really, really cool. Yeah, holy cow. Yeah. Yeah. Yeah, you need all kinds of yeah. It's different with us, but I mean that's okay. Like I mean, you know, I tried to. Yesterday, one of the students was with me, and I felt a little bit bad because I had been gone last week on vacation. Then yesterday, or on Tuesday, I was here with bananas, and we went to the med school to get teenage placement. So like I got there yesterday and was just kind of like, oh my gosh, still kind of playing catch up. But like I was like, all right, here, like she got to go see one of the other nurses do like contraception was there, so we also like provide contraception and prescribe that based on. And so she got to see that, and then just kind of. I set them up as a every 15 minutes, and so very repetitive, which I love that, but like it was probably in her eyes was like, wow, this is kind of boring. Like it's kind of why I perceive it because like it's easy for me, and I'm like good at talking and communicating, or just being completely like honest with people. But like that's a hard thing to kind of come by. I'm also there, you know. So like I think that was like up here. Yeah, right. Like that's just it. Like I remember last, and our preceptor was amazing last. The one last week we had, but there was one. She's like, I actually can't be in here because she's like, I know that person, you know, and like that is. I even had like students that come in who are like, you know, I wasn't sure what the schedule was, but like I know one of the students in there, and I didn't know. I want to make sure she doesn't know I'm here or why I'm here, and it's like so that it gets a little bit like fuzzy because there is like even though it's huge, like it's still small at the same time, and like but I do think they get to appreciate it. A lot of them don't know. I was actually going to talk to I think she does the teaching, like you know, I keep saying that like there needs to be more like we provide, like people don't know that like we're there, and like I think I remember last year like. Right before the end of the semester, there was an influx of STI testing. Like it was in Indiana, it was like almost double booked because they had talked about it in gender studies about community and gallery testing and how like the CDC recommend do have it like once a year, and they're like, what? And so I don't know how many like 20 women plus like, oh my god, we just talked about this, I've never had this, I need to be here, and I was like, I need to talk to them and be like, thank you, and also like, maybe I should come there, maybe I should be part of that, and be like, this is what we provide, you know, because it's just not an elector, because like, right, I mean really, like, I think like that's, I really think that that is a huge, there needs to be more collaboration, kind of like, so I don't yes. Yes. I know. Well, and I think they're just so funny. Like I had yesterday, I kind of could see her smile a little bit, and I was like, I just am like, oh, I don't know, that's what should be sex. Like, and they're always like, it's normal. We're human. Like that's like we're here to tell you that like you should be, and like it's supposed to be great, but like we're gonna help you make informed decisions. And then they were just like, and then that's she's like, they were in my office crying because like from what they were told growing up, and I'm like, I'm not gonna judge you. I'm gonna just help you like make good decisions. And when we're human and we make on the fly decisions, like that's what we're here for, to like work you through that. And I think they're just kind of like, oh my god, Kelly, and I'm like. Like my 13-year-old's like, my mom has comments in my office that I don't want to tell you. Like, there's... oh god, no. Like, I'm like, I know, no, I'm like... Yes. Well, and they also should go to, Badger Market and sell it for $13. Yes, so these are things that at the union has to make heavy. That's exactly, that's what I mean, and so our students don't know that. Yeah, but it is, yeah, I know, that's like, and so, usually my son's just like, yeah, that's what I mean, like, I'm like, I wasn't raised like that, but like, I'm like, talk about that, I'm like, yeah, we just talk about like, it's just, oh yeah. Yeah, we talk about it in the car when they can't, like in the interstate, that's when all these conversations, they can't get out. So like we're going 70 down the interstate, and my husband's talking about it, I'm going back from baseball, it keeps popping up under his friends this summer, let's say, like, and I was like, what are you gonna say? I was like, it's okay if you are. I was like, but, let me make sure you have the, you make comments or you tell me, I'll make sure, and Drew was like, I know, like, right. Yeah. I know, and that's why it's like the more I can normalize it and like talk to my friend, like, like, yeah. Right. Yeah. A lot of people say too, like, now my mom and dad just want me to get better. I was like, well, it's like you're 18 and you can make your decisions now. And I was like, well, you have an age out. And so if it's something you want to do, you get to make that choice now. And like you put the power in their hands. Like, you know what, like, that's okay. You were underage and they made that decision.
Hello. We had a really nice conversation, and it sounds like other people are too. So maybe we could just take a couple minutes and just, we want to do this other quick activity. So just name some concepts and the exemplars you thought of as they play out in your setting. And again, there's no right or wrong here, but just throw some out there. I'll get started from the talk I had with the nurses from Reedsburg. Just they talked about how strong their nurse lead is in evidence-based practice and how good they are at applying guidelines. So that's an excellent exemplar of evidence-based practice. Oh, you talked about a lot about health education. Okay, and what's something you said about that?
Just how, I mean, not only in our setting, but just like in life, like just normalizing sex education and that not making it odd or, just it is what it is. Like, here's condoms, here's this is what we're going to provide, and it's normal. And instead of being reactive, being proactive, kind of, and providing them the resources they need to make informed decisions.
Oh, that's really great. So what a neat example of nurses applying health education to sexuality and making sure, in just normalizing the topic, making sure people have the resources so that, as you said, they can make informed decisions. Very good. How about from our friends at Ho-Chuk? I bet you had some really good concepts and exemplars.
Well, one of them just is the culture of congruency. Continuing learning about the culture, and that's an everyday setting, really. We do a lot of collaboration with tribal aging units, so they go to tribal aging units, see the elders in the meal site there, and our elders are looked on as that's who we go to as far as learn some of the things that we need to know. And also I'm thinking of just the Native Nation Nurses Summit that's coming up too. We're hosting that, and so hoping that they can be kind of involved in that as well.
Excellent. So a couple of key things there I see, and let me see if I can remember them all now, but culturally congruent care. So just 8 weeks at the Ho Chunk Health of Wellness is a great way to exemplify cultural congruent care and see the importance of that. And then collaboration, you mentioned that the Ho Chunk Health and Wellness collaborates with tribal aging units. So a systems to systems kind of collaboration, that's really neat too. And then when you talked about attending the Native Nations Nursing Summit, and my thought was, ooh, that's not very far. Maybe I'll get to go. And just, that reminds me of professional nursing leadership, just continuing their own education and learning about another healthcare organization. So there's many things that attending that conference would bring them, or concepts that would illustrate. So I'm sensing that people really get the idea of the concepts, and it's not a big leap to think about, to kind of connect your practice site with our framework, that's doable. And again, we don't expect you to do it all, but just to have some idea of what the students are learning, or how they're learning and how that might play out. Okay. All right. Well, then let's do the second exercise. In your folder, you should have a schedule. It looks like it's got the course learning outcomes on one page, and then probably some blank. Yeah, there it is on the bottom on your right there. Okay, and if you could just hold that up. Okay. It looks like this. And you'll see the course learning outcomes on one side, and then just blank spots for 8 weeks on the back. And as some of you have had a lot of students, you probably know your routine, but we're thinking the idea here is if you can just elaborate on your plan with students. What do you hope to accomplish? What are salient features at your practice setting that you can schedule in? And our thought here is that you're not always reinventing the wheel. What are things you want students to do and see and participate in? And is there any way to organize it for yourselves? So let's just take a few minutes to work on that, and then let's take probably 7 minutes, and then we'll wrap it up and share a little bit and move on to the last section.
I also did put up one of our assignment templates just in case while you're working you want to look at the sort of questions and the things that we ask students to write about in their journals.
I don't have any details on that. Yeah, but it's great if they attend. It's kind of different, but that's really good idea. Yeah. Or even like I said, I try to get have them see like an IUD or an explanation procedure, all those things too. If they're on my schedule, on the provider schedule. But even doing the depots with Emmy, going in and watching that as we've done. And I agree with about the hands-on skills. That's really nice for them. But we all, in this course too, and at the school, we're also really trying to see that nursing is right. Yeah. And applying what you learned. Yeah.
The weeks go by so quickly that by the time we really run out last week, they finally need to do an assessment of so just trying to figure out what I want to focus on, so maybe just three things. Like if they're looking at medications with the conditions that they have and are inside of those medications, and then from there figuring out based on their conditions. There's just so much.
Yeah, that's really good. Yeah, yeah.
This person's a flawless and they've fallen twice.
And then, just think all kinds of examples.
And they want to return home with their appropriate place to really be having a conversation. If they're going to return home, Tuesday, and so based on that, what the students are there, or Wednesdays, and
That's a good idea. Yeah. Well, that sounds good. And what I learned always think about too is, what are my goals?
It's like,
Things that might
you did enough with the student and that semester because maybe they could come to, and that be like a self-directed time or something because that's usually not what
yeah. Hopefully we sit down, because yesterday we had a little orientation for a couple hours, so I showed her a few things that we had and then we went like that, so so I think I'll just send her an email and say this is kind of the template for most go about their day. And then just expectations of what I'd like her to know, just brainstorm on like how long
in the spring there's no balls, but in the fall,
You did all the talking. We didn't just listen.
I know, but like that was great. Like we're gonna have a great, like what a great experience for that student too, because they get so many facets and like get to really apply a lot of what they've learned and like going like rather than just being at a center, like going out. I think is a whole new like experience for them that really will give them like insight into like other areas, or like then giving them that like what was it was ago that was talking about elder population that really need help and like that gives them like something outside of nursing home experience that really still gives them that opportunity to see all the
that's always my goal is if they end up working in a hospital or they just know that other side of things and in care plans and what that means and what we can do how that affects us. A lot of times we get orders from clinics, they just send orders, we're not making us know their information. So then we're calling them that and I say, what are the discussions that we do about what's the most necessity, just so we understand what's being ordered. And then explain that we need to send it prior to we know who actually provide that. We essentially just have to bill and determine if it is necessarily paid for. So, and they're like, I have no idea.
Right, that's just it. I know. One of my, or this student that I had yesterday, it just kind of pointed out, like, where have you been before? What do you know? What you kind of interested in? Or usually, what I actually first ask people is like, do you know what you don't want to do? And they're like, oh yeah, like because it's easier to say what you don't. And she's like, yeah, I know that like I should work in the hospital first, get second, and I was like, actually, like I did work in the hospital. Like I worked in a hospital nursing assistant, and I was like, but like. Because I kind of feel like that's just like this little bit of a middle. I was like, not everybody is cut out for that. And like, there's different things. I know. And I was like, there's so many opportunities out there. And like, you get, and like, that's not for everybody. Like, I bless people who can get on their feet 12 hours and 12 hours. Like, and that's just not me. And I wouldn't excel in that. Like, that's not where my strengths are. But like, God, there are people who can do that, but I was like, I tell people, like, kind of give them, like, actually, like, if that's not what your leg is calling you, like, that's okay. Like, that doesn't mean, like, you're not going to be under somebody else. Like, you know, so I try to, like, or not bash it, but, like, smash that, like, myth a little bit. Because, yeah, like, that doesn't, yeah. Well, yeah. Yeah, absolutely.
Okay, I think I'm just going to check on that and we'll see what's come up.
How long have you been at
Okay, I think we'll wrap it up because I know Jessica's got another last section to do with you. And again, good conversation I heard. And I know that all of you have had students or have students. So any new thoughts you had today about the schedule and how you plan it, or your plan with students?
I just know they have to be really flexible in our setting. Because if they can come in and it might be we have 3 home visits, you know, set up for that day. But if there's a death in the community and it just shuts down, all them people are there for that family. And I mean, the biggest thing we can do that day is go to the grocery store and I'm buying $20 worth of bologna and sandwiches, bread and butter and a bag of apples to bring to the site, you know, where they're gathering. So, I mean, that's just, you never know what's going to happen.
Well, I think, and that's a great thing. I think that's one thing we all value with community health experience. I mean, it happens in acute care too, is being flexible. And then if you can build that in to the students' expectations, I think really helps. And even owning it, emphasizing it. And what does a nurse do to be flexible? So, excellent. Any new plans or insights or something you already value about your plan that's working out? Okay, well, one thing I heard that I really enjoyed and is just thinking about what are your goals for the student? What do you hope the student accomplishes? And what do you want to accomplish in this 8 weeks? And starting from there, I think that's an excellent starting point to plan your activities. And so thank you, and I'll turn it back to Jessica.
Hello again. Forgot. Must use microphone. Okay, I kind of like having this small group because I feel like I know all of you now. So anyway, we're just going to wrap up here because then we have lunch and I'm personally really starving. But sorry. Anyway, this is an example of our assignments, just so you get an idea. And I can either post these or attach them to my letter. But these are the types of questions that your students are going to be like thinking about and writing about in their journals. And so, we put care into giving them a purpose, relating them to the course outcomes, and then, like I said, really getting them to think through, like, okay, if you consider social justice and culturally congruent care, like how did you integrate these into your work or just into your thinking about what you were doing, right? And, I guess the unwritten question there is if you didn't or you don't know what those things are, why, right? And so we get them to try to think through the process. How did you foster open communication, mutual respect? These are things, it's the same journal for all 4, but obviously there are going to be different situations in each clinical setting, but really getting them to think through the process of all of those, not only course objectives, but their clinical judgment. So as I said, I'll get those on the email, hopefully, or on the website. Okay, so this is not my area of expertise. I'm just going to say that right off the bat. Usually someone else gives this part of the presentation who has way more knowledge of our resources here on campus, but I'm going to do my best. And I'm also going to talk about some things that students have said in previous years. So we do have a mission related to diversity, which you can read here.
We work hard to offer an academic environment that is inclusive but also safe. And, we talk about safe practice in the clinical setting, but we also want a safe environment in our classroom for all of our students. So, we make sure that this is well known for our instructors, our, clinical partners, and our students. So one of the things we do here at School of Nursing is employ holistic admissions. And actually, I'm on the admissions committee now. So I will have an even greater role in administering admissions review based on holistic properties. We now interview all of our students that apply to the program. So we get about 500 applications to the program for 160 spots. And everyone who meets the criteria for the prerequisites, the GPA, all of those basic factors get an interview. And so we now interview all of our applicants. And it's a group interview. So it's 4 students at a time with 2 interviewers. But it really rounds out our holistic admissions process. So everybody gets a chance to come in and everybody gets a chance to talk about why they're applying and what their goals are. We also have a writing experience during that interview session. So after they talk to us, then they go and they have a question that they write about for 15 or 20 minutes. And so those writing samples are just, kind of off the cuff, like, here's your question, write your answer, on our computers, and then that's the end of it. There's no editing process, except for on the fly. So we've really worked hard to include a lot of different pieces to our admissions process now in an effort to bring in all kinds of students and to build a class with a lot of intentionality. Here is a list of diversity and inclusion in the curriculum, and I hadn't actually seen this list before I got this PowerPoint. So, but you can read here how we have worked to weave integration and diversity through the curriculum in a variety of different level courses, and these are just the ones in the School of Nursing. So students can also take electives, obviously, outside the School of Nursing, and work all different kinds of coursework into their electives. But these are some of the ways that we have woven it through our curriculum. I will say that so I took some students to Thailand this summer. I took 8 students to Thailand for a community health rotation. It actually replaces this course this fall, and which was amazing, but I won't talk about that because I could go on and on. But so this fall they don't have my course, so they got to pick an elective, and I'm telling you, somebody is taking a class about humans and plants. The relationship between humans and plants, throughout history. I mean, someone's taking sign language. I was so impressed with the way that they have chosen, their elective classes to just complement their nursing education in amazing ways. So anyway, I was just thinking of that when I was thinking about electives across campus, but also within our curriculum. One of my Thailand students is taking the culturally congruent care course. And I know the professor of that course. So we do offer some really high quality elective experiences here related to diversity. Here's a list of other engagement opportunities, not only through School of Nursing, but sort of in partnership with other health professions and across campus. And there are also opportunities for faculty and staff, which you can read here too. I do have I do feel like we have a lot of opportunities here to engage and constantly learn and grow and become better at providing inclusive classrooms here. UW-Madison is very supportive of its faculty and staff when it comes to providing those opportunities for growth. Here's some of our community partnerships. Not only on campus in Madison, but also throughout the state of Wisconsin. I'm involved in a project. We got some grant money. We partner with Madison-Dane County Public Health to go out to dairy farms and provide TB testing and immunizations on the farm so that the workers can get these immunizations and TB tests in between shifts. So some interesting things in terms of outreach, and we're hopefully going to involve students in that this year, just to, give them sort of local, global healthcare experience, right? Kind of in their own backyard. So that's just something I'm personally involved in, but how can you get involved? So we are going to be sending out a list. You guys are probably like, oh my gosh, we're going to get so many emails from you. You will get an email about our Lunch and Learn series hosted by this school. Our diversity lunch and learns are always pretty popular. So we'll send that out. But we have other opportunities here. See your summit listed. The other thing is this is a two-way process. If you have stuff that you're doing that you would like us to advertise to our students, that's something like a lunch and learn, a lecture, summit, let us know, because we're happy to provide those to students. The other thing I wanted to quick show you before the lunch. So I just dropped this into the box. This is something that we give to students and that we talk about with students at some point during the year. Last year it was in spring. We'll probably try to put it earlier in the year this time. But it's about microaggressions. And one of the things that I heard from students last year, unfortunately, is that they either witnessed microaggressions in their clinical setting or they were actually received microaggressions in their setting. And, it's hard as a faculty member here because we're not there, right? And we can't address it in the moment. But students will come back to us and say, I'm struggling, like this happened to me and it was hurtful and nobody knew what to do. And so we provide this handout to students, and we also provide support to students, and we provide support to preceptors. I'm not making any assumptions, but I have heard in the past, that sometimes preceptors just don't know what to do, especially it seems like in the, more acute care settings where things are happening like on the fly. And, but what I tell students when they have received a microaggression, and what I try to get across to preceptors is, often as nurses, the response is, well, that's how patients are, or that's just how it is in nursing. Like, we all put up with it. Like, this is just kind of the way it is. But what I say to students is that, it doesn't have to be the way it is. And I know that as a student, you're not in a position of power in this situation at all. And, you're with someone who's grading you, you're with a patient, it's uncomfortable, it's awkward. But what I always try to encourage them is, going forward, whether you're a preceptor, a faculty member, a student, simply having things to say, like the things that are listed on this paper. simple, respectful, but just keeping in mind that this isn't how it has to be, and it doesn't have to be this way going forward. And the only way to change that is to actively address these things. And, as preceptors and as faculty, I mean, I've been in that situation before too. It's very awkward, but I just don't want to see students, carrying that legacy forward of silence and acceptance of microaggressions or racial or sexual harassment in their clinical setting. So if there's ever anything we can do to support or help you as preceptors, if you would like more resources, we support the students when they come to us on our end, and reinforce the fact that bias is unacceptable. But we're working in partnership with our sites, so we really want to make an effort to provide support. But unfortunately, students have had this happen, and it happens pretty regularly. And hence bringing resources that have simple things. We actually practiced this in seminar. We had a whole seminar on microaggressions. We practiced saying these things out loud. And because saying them over and over again, maybe when you're in that moment, we tell the students, then you'll be able to say it. You'll be able to say out loud, like, I deserve to be treated with respect, because sometimes you just have to keep practicing it until it comes out at the right time. And so, we helped students practice that, and we give them handouts like this. And it seems really simple and straightforward, but I do think that we're slowly making a little bit of progress. But I guess I just want to reinforce that, we work hard here to promote a safe and inclusive learning environment. And so whatever we can do to help support the students and you in the clinical setting, we want to do. So please let us know. Any questions? Like I said, I put this in box. I don't think it's in your folders because I didn't put it in until today, but I can also email it too if you think that's helpful. Yes, Karen. No, in the box folder for this workshop. They should. It went out in the email. The link to the box went out in the email. Did everyone get the email? It was like last week, and it should have said like, hey, here's the parking instructions. Here's the link to all these PDFs is in there. But like, if it would be helpful, we can resend the link too. Yeah. Okay. We'll just resend it. Not a big deal. I can also link it like on the Preceptor webpage, because they're all collected in this box, which is just a place online. But do we have everybody's email that you sent out last Friday? Can we just resend the link?
Yes, I can send it with the evaluation.
Oh, that's a good idea. Okay, so Nikki's going to send it with the evaluation for this workshop. Woo, fill out the eval. Yeah, that'll be great. So any other questions? Plus, if you remember something and you can't find it, just email me. I'll send it to you. I'll send you a whole bunch of other stuff too while I'm at it. Just kidding. Okay, well, if nobody has any questions, we can go eat taco bar. Is that what we're having? Sandwiches. Oh, sandwiches. Yay, sandwiches! So we'll see you out there. Thank you so much for coming today. It was so nice to meet all of you.
Can I do anything?
Well, I'm just like getting things off the. I think I'm gonna put everything in the recycle bin here.
Yeah,
on the
that's a good
laptop,
idea.
And then I'll just log everything out.
Uh-huh.
So then we should be good. I think.
Yep, I just messaged
Oh, great.